Wel, croeso cynnes iawn I chi I sesiwn trafod arall yng Cynhadledd Rithwyr Plaid Cymru ac I sesiwn yn edrych ar ddyfodol iechyd a gofal yng Nghymru. In this session, we're going to be talking about what a Plaid Cymru government has to do to make Wales a truly caring nation anyway, but to deliver policies that make us a truly caring nation. You may have been listening to my conference speech last night when I reiterated our pledge to establish seamless health and care service for Wales. People-centred, promoting people's independence, preventative, truly preventative in focus, bringing parity of esteem as well as parity of pay scales between nurses and care workers, and delivering social care, just like healthcare, free where people need it. It's a transformative programme. I'm excited about it, and I'm hugely grateful to the Care Commission, set up by my predecessors, Di Lloyd and Helen Mary Jones, who brought us the radical proposals that we look forward to delivering. Y cefndir wrth gwrs ar hyn o bryd ydy'r pandemig da ni'n byw drwyddo fo ar hyn o bryd, a'r gyfwng sy'n gwthio gwasanaethau iechyd a gofal i'r eitha, ond mae hyn wedi atgoffa pobl wrth gwrs o werth iechyd a gofal a'r gwasanaethau hynny I ni gyd. Felly sut ydym ni am adeiladu gwasanaethau'r dyfodol? Mae gen I 3 yn cadw cwmni fi ar y panel. Pleser mawr croesawu y 3, Dr Cynhadledd Dycker, meddyg teulu, ymgynghorydd iechyd gyhoeddus i'r World Health Organisation, cyfarwyddwr yr cwmni ymgynghori iechyd tro da, ei gwaith I yn canolbwyntio ar fenywod iechyd plant, tegwch rhyw a gofal iechyd cyffredinol. Y cynghorydd Alun Williams efo ni, cynghorydd Sir Plaid Cymru, Aberystwyth, aelod cabinet dros wasanaethau oedolion ac un eisteddodd ar yr Comisiwn Gofal holl bwysig na. A'r cynghorydd Lian Lewis, nyrs yn y gwasanaeth iechyd a myfyriwr cyfraith feddygol, sy'n bynnag mae'n cael yr amser I wneud y ddau beth, yn gwybod pa mae'r galed mae nyrsys ni'n gweithio, ac mae hefyd yn gynghorydd tre Plaid Cymru ym Mhen Coed, wedi sefyll fel ymgeisydd I Blaid Cymru yn yr etholiad brys y llynedd ac yn sefyll ym Mhen y Bont yn yr etholiad y flwyddyn nesaf. Croeso i'r 3 o'na chi. Da chi wedi cael cais I ddeud chydig o eiriau, ryw rannu ambell beth sydd ar eich meddwl chi. Cynhadledd, do you want to go first?
Thank you very much, and thank you very much for inviting me to take part in this really interesting and relevant panel. I think it's true to say that the COVID pandemic is one of the most destabilising things to have happened to our society, certainly within my own lifetime, and it's caused untold suffering and damage to lives and livelihoods across Wales and the world, and continues to do so. Despite being the focus of all of mine and my colleagues' attention this year, we still do not know its impacts, especially in the long term. So I think it's hard to predict with any great certainty what may or may not happen in the coming months and years. But what I do feel more confident to talk about is how we, and especially the health system, have coped with the pandemic so far. For me, the most obvious and distressing part is the disproportionate impact that this disease has had on poorer and underprivileged communities and on the Black and minority ethnic communities. But while the disease itself is unprecedented and unpredictable, the way it's playing out, I don't think is. We have a health system which has been crippled by 10 years of austerity and by constant attempts to undermine its core status as a free-to-all public service. The NHS was already struggling to manage and meet the demands of the population despite its hardworking and dedicated workforce, and now it has to manage a global pandemic. It's no wonder that it's struggling. Added to that, in lots of poorer communities, people can't work from home. They have to be out and about meeting people. And these are in many ways the most important members of our community. Health workers, care workers, essential service providers, bin men, people who make sure the shelves in our shops remain stacked. People and services we simply couldn't live without. Poverty, austerity and health go hand in hand. So for me, as we look to the future, I would suggest you can't have a healthier population and you can't have systems that are equipped or at least better equipped than they have been to deal with pandemics, unless the least well off in our society can also enjoy the advantages available to others. It's one of the fundamental principles of public health that a population is only as robust as its weakest element. And that, for me, is the principle that should guide our plan to recovery here in Wales. Social inequality equals health inequality. You can't save the economy if you don't save the lives of the people who keep it going. Thanks very much.
Thanks very much for those thoughts to kick us off, setting out some pretty important principles about why we're trying to do this at all, to provide the health equality that we want to see. Alan, llai droi ata chi?
Yeah, well, Plaid Cymru's Care Commission set up to look, as you've said, at the serious challenges facing social care, led by Di Lloyd and Helen Mary Jones, published its report last year. And the Commission received evidence from 27 presenters across health and social care organisations all around Wales, including Social Care Wales and the NHS Confederation. There was really good engagement with the Commission from everybody. What we found was that social care and health are so inextricably linked that it really makes no sense to treat them as separate entities competing for funding any longer. Investing in social care is investing in the health service, because it prevents people needing the health service in the first place, and because the care of so many people is intertwined and spread between the two. And it's this prevention and early intervention agenda that we need to be focusing on in order, yes, to reduce the demand on the health service, but most importantly, to make for the kind of healthy, enabled society for everyone that we all want to see. And if we want this, we have to value our social care staff. It makes no sense for health and social care workers to be on such different wage scales. Social care staff are, like nurses, the people we entrust to look after the most vulnerable, and they need to be given the respect they deserve. The Care Commission felt strongly that all social care should be delivered free at the point of need, just like health, and preferably paid for from general taxation. And to achieve all this, the Commission recommended a single national health and social care service for Wales, with strategy managed nationally rather than regionally by health boards, and services delivered locally by bodies coterminous with local authorities. That's the kind of revolution our health and social care services need for the 21st century.
Alan, diolch, and last but very much not least, Leanne Lewis.
Hi everyone, and thanks for inviting me today. Yeah, I'd like to just reiterate and agree with everything that everyone has said prior to me coming on. For me, I think I'd sort of just like to talk about the impact the pandemic is having on health and nursing staff. I'm currently working in one of the hardest hit hospitals in Wales, and staff are absolutely exhausted. I know that the pressures, not only are the pressures within the hospital, but there are huge pressures as well within social care and within the independent care home sector. For me, there was a disparity between health and social care anyway, but I think COVID has just sort of highlighted how big that disparity is. And yeah, I mean, health and social care staff are invaluable, and I agree they need to be valued more.
Yeah. Diolch. Camilla, if I can start the wider debate with you, what do we mean by integrating health and care? Because there is an acceptance that we need to do it. It is the best way to operate. Make sure that you don't have competing forces behaving like barriers to the care that people need. How do you see that integration and why it is so vitally important?
I mean, I think it's incredibly important for the reasons that have been highlighted by Alan and Leanne, that we don't value them and the social care in the right way as much as it should be, and that comes down to financial in the first part. And as Alan said, if there is a fight for funding, then you're losing the crux of the problem. And if it comes under one umbrella, then the funding can be much more cohesively thought through. I think it's also about making sure that there is equity, so that people get the care, both the healthcare and the social care, when they need it. It's not about being able to pay for it. And so again, it's looking at the whole model and making sure that you have it all under one umbrella and without privatization. And I think we know that the privatization that's gone on within social care, and now privatization that's going on with our healthcare, it doesn't increase quality, it doesn't help the user, and it doesn't promote equity or equality. So I think that it's just going back and putting them together, starting again with a model that allows for the funding. And we know that we're going to have to work more with less money. There's not going to be more money after this pandemic, and so we need to be smarter with our money, but we also need to think about the beneficiaries at the end of what we're trying to do.
And I was I was hearing a case in the past few days of somebody who'd had a stroke and had been in the health service following the stroke, and then needed to go into that sort of separate care service, and nobody of the private care providers would bid for the ability to provide that package for the person. Now that's not right, is it? That's the opposite of seamlessness, Sally.
Sorry. Yeah. Of course, Welsh Government's very fond now of telling health boards and local authorities that they should be working more closely together, and that sounds sensible. But and they've set up funding mechanisms through regional partnership boards that more or less compel them to do that. But it's all very well them saying that, but the core legislation actually doesn't support it. They're different organisations, health and social care, with different legislative frameworks, different ways of accessing funding that are often in competition, and different rates of pay for their staff. So the authorities are actually doing their best to work together in an environment that's full of obstacles. And of course, when local authorities in particular have been starved of resources. So it's very, very difficult when you've got two separate kinds of organisation competing legislators, and that's why we need a proper integration.
And which is why I, at the instigation of the commission that you were a member of and worked so hard on, I've said that we will have a national health and care service for Wales, which will provide that framework which builds in that cooperation, not waiting for the examples of cooperation that are out there. And Camilla, there are brilliant examples of cooperation between health and social care, but it quite often depends on the personalities involved. We can't leave it to chance in that way, can we?
No, I really don't think you can. And I really agree with what Alan was saying, that people do cooperate, and you have amazing people out there trying to make it work, but yet the legislation is working against them and the funding is working against them. And so even if you get examples of excellence, how can you replicate that? without replicating the people. And we can't, we have a health system and a social care system built on goodwill. And that goodwill, as Leanne said, people are burning out. Of course they are. The resilience, the amazing, my colleagues in the health system and the social care system, they can't carry on forever trying to hold it together with goodwill. So we need a framework and we need the funding to follow the ideal.
And there's a degree of goodwill that's needed to go to work as a staff member in the care sector. For example, we know salaries are way too low, which is why we want to bring in care workers onto the same pay scales as nurses. I'm sure, Leanne, that you work alongside people who perhaps started in the care sector and then progressed to nursing, which is great for nursing because you're bringing new people in, but it's terrible for the care sector, and the care sector can't compete. That's not sustainable.
No, and I think that's, to be honest, when speaking to care homes and to independent sort of social care providers, that is one of their biggest sort of issues, really, is that they're finding that they're employing staff, they're getting trained, they're working for them for sometimes several months. Then they tend to move on. Then they'll come into the NHS because, as you said, the wages are better. They guaranteed pensions, they guaranteed annual leave. There's the sickness benefits as well. So they find then that there is a void. And back about 6 months ago, I know in one particular area in the health board that I cover, a lot of social care providers actually left. Carers left and went to work for Trago Mills because they provided better pay conditions and better work conditions. So it shouldn't be like that. We need the experience. We need these people because when presently when people are not sort of they're not able to have the capacity to provide those packages of care, we've got individuals in hospitals, and they're risking, when they're medically fit, they're risking becoming unwell again by picking up hospital-acquired infections and now COVID. So it's, I think it's vital that we get this sorted out.
Yeah, and we are thinking of you in your place of work because I know the stress that you are working under now. Let's turn to working preventatively. Why is that so important, Camilla?
I think it's important for so many different reasons. I think that prevention, as they say, is better than a cure, but it's much better to keep your population healthy. It's cheaper, for one thing, really, to be able to prevent, and treating early is always better than people becoming very unwell, acutely unwell, and having to use services. We know that 90% of medicine is done in primary health care, where prevention and preventative medicine is so key, and yet so little of the budget is put into primary health care, and so I think that it's so important that primary health care and general practice is prioritised, both in terms of funding, but in terms of how important it is for the health of the population.
Yeah. We need to drive up that portion of the health part of health and care funding back up to the equivalent of what would be 11% of the budget, rather than it's gone down to something like 7% or something now, hasn't it? But of course, that would be a new integrated budget, bringing it all together. Do you find it difficult in your sort of cabinet role, Alan, to be able to invest in that preventative side in the way that you would like, because we're on that sort of wheel that's difficult to come off, of treating people and caring for people when they have become ill? Yeah,
and when you're struggling for funding in all ways, it's terribly difficult. But we do have to invest in prevention, and when I say prevention, I mean right across, taking it really wide. We need encouragement of active travel by creating the infrastructure for that. We need acknowledgement of the health benefits of green spaces, healthy eating, low smoking rates. We need decent housing, including plenty of extra care housing to prevent people needing to go into care homes. And these are the kind of broader societal issues that should be included in prevention. But ultimately, prevention it's better apart from saving money. It's just better for everyone. It makes for a nicer society that we all want.
Is it something that frustrates you a lot, Leanne, sort of professionally, knowing that people that you're looking after could have had a better chance had there been earlier intervention in a whole host of potentially different ways?
Definitely, yeah. I cover an area where we sort of the catchment area for the hospitals. We have the most affluent sort of within our county, but also as well, we care for some of the more patients in the deprived areas, and the differences between them are phenomenal. We see people who are coming in who really, they've been let down. Sadly, the capacity is not there, or sometimes the understanding is not there, that they're able to access these services. I can remember as a student nurse going out and carrying out over 75 visits with a health visitor. Things then were picked up, and the health visitor went along, done a check. Not only was it on somebody's sort of physical well-being, but it was their emotional well-being as well. So, we were finding, I can remember going to visit someone and, she was struggling a little bit. So the health visitor then made a phone call to social services, is that early intervention. So we didn't get to the point then where further on down the line, she presented herself to A&E because it was a crisis point. So I think, we do need to be focusing on early intervention.
Yeah, that crisis, isn't it? We currently have, we use the terms illness service rather than a health service, Camilla, and we've got to make that shift from the illness service to a health service, with that preventative agenda. Problem is you've got to pay for that transformation, pay for the preventative at the same time as you're still dealing with the legacy of failing to have done so in the past. One of the ideas that we're proposing is, for example, bringing in a levy on some of the most unhealthy foods, changing people's lifestyles, making them healthy in that way, helping to contribute towards that transformation fund. It's a complex thing to do. It's an expensive thing to do, but Camilla, it just has to be done, because otherwise we're just going to be going round and round in circles.
Yeah, and round in sort of ever decreasing circles. I think everyone's talked about the sort of decreasing capacity. And I remember when I first became a GP many years ago that we had more capacity to follow up with our elderly patients, with families who we thought were struggling. I had more capacity to go around and visit people because we had a little bit more time. So there was that small amount of capacity we had. In the first GP practice I worked in, which was in quite a deprived area, we had someone who helped our patients with their filling in forms, and we had a high refugee population, and actually that was so critical because it helped people to be able to get the benefits that they deserved and they needed, to be able to get people to be independent and be healthy. So if now that service wouldn't be there at all, and mental health, now you can be waiting 6 months to a year for counselling. If we don't look after these small bits, and they say it's a small service here and a small service there, then you do become an illness service, because you are only firefighting the critical issues, but actually you'll never get to that point where you have a healthier population who can actually themselves learn to live healthier lives and enjoy those healthier lives, because that's what it's all about. It's about the quality of life that you want to give people from the service that you're providing.
Alan, one of the number of key principles that came out of the Commission's work was this idea of making care person-centered and promoting the independence of the individual. Another kind of independence campaign, if you like, within Plaid Cymru. What does that sort of promotion of independent living mean to you, thinking of your role as that cabinet member in Cynhadledd?
It's independence is fundamental, isn't it? Instead of treating people as blocks or units, treating the individual person. And independence. Extra care housing is an example of promoting independence. The kind of housing that's specially adapted so someone can go into it relatively healthy, and they're going to deteriorate because of their particular illness, but they can deteriorate and still stay living in the same place, and without having to move into what we talk about as a care home, where we know people lose their abilities and independence once they're in a care home. If we can promote more extra care housing so that people can stay in their own home, that are homes that are wheelchair friendly and specially adapted for illness, that's the sort of thing that can help to promote independence. Because independence and stimulation is the basis of good health.
Yeah. And you compare that independence with somebody going into a care home. Care homes are fantastic if you need to be in a care home. The problem is if you don't really need to be in a care home. And what about then people, because of delayed transfers of care, that terrible phrase, bed blocking, who are left in hospital longer than they should be. That must be difficult for you, Leanne. Seeing patients of yours who well, not nowadays, I guess, with COVID, but people who don't need to be in hospital, and it's actually harming their well-being, taking their independence away, them being in hospital, and they're there because of that lack of joined-up thinking between health and care.
Yeah, I mean, as a discharge liaison nurse, I see this day in, day out. We become frustrated for the patients, because the patients they become deconditioned. There is no stimulation for them in hospital. Every day is very much the same for them. And with that, then you can see them slowly, they're losing their sort of independence. I've got to agree with Alan. I mean, Extra Care is a fantastic facility in the county that I live in Bridgend. We have 3 presently. I've supported a number of patients to move on into Extra Care, and they've thrived. They've been able to maintain that independence. They've also, they've also built a new network of support as well with sort of fellow tenants who live there. With regards to I hate the term bed blockers, but sadly, it is a real issue within the health service, and I think part of this as well is with the cutbacks with local authority. If a patient is deemed to be requires funding via support by the local authority, independent care homes now are requesting third-party top-ups. In some cases within care homes, that can be £180 a week. And families are the times are hard anyway. But you're asking some families to pay an equivalent to a mortgage on top of on top of, you know, what their loved one would pay anyway. So that is a huge issue for us at the moment.
Yeah. But again, coming on to cost, the free delivery of social care, it's exciting to think that we're about to do it, hopefully in government. That changes everything, Alan, doesn't it?
Yeah, absolutely. You know, as Di Lloyd in the Care Commission would point out, if you get diagnosed with cancer, you have free care. If you get diagnosed with dementia, you have to pay for it. And that is completely wrong. There's no moral justification for it at all. We need social care to be free at the point of need, in the same way that the health service is.
And we look forward to delivering it. You know, it's been interesting. It's good to be talking in terms of health and care, and yeah, I look forward to being able to do so in government, just changing the culture. And thinking of the culture, when we look at some of the key figures in relating to the COVID pandemic in Wales, and you know, Mark Drakeford as First Minister is there always, and the Health Minister is there always, and the Chief Medical Officer is there, and quite often the head of the NHS is there. Where is the head of care in Wales? Where's the chief care officer for Wales at the right-hand side of the health minister? The truth is, she or he isn't there because we don't have one, and that tells us a lot, doesn't it, Camilla?
Yeah, and I think given that the mortality in care homes in the COVID pandemic in the UK and in Wales, but you know, has been a tragedy and continues to be a tragedy, and it should be something that we should have got better at, and yet still it's a problem that COVID is surging through care homes. People, you know, are still reporting that they aren't getting adequate testing, and if they are getting testing, they aren't getting the results in time, that there isn't adequate PPE. You know, we're 6-7 months on. It should have got better. So the fact that there isn't somebody standing up there, I think, just highlights the tragedy even further, because somebody should be answering to that.
Yeah. Does that make your life difficult, Alan, or potentially in knowing that you haven't quite got that direct line of influence between you as the sort of adult services cabinet member into government?
Yeah, of course. You know, COVID has affected both health and social care profoundly, and you know, examples: lack of integration has led to care homes admitting COVID positive patients from hospitals, and to care home staff being unable to access PPE at the start of the pandemic. You know, and we've seen the farce of the Westminster government's track and trace system, centralised and privatised. It's shown how vital it is that we have decentralised systems in place, systems that use the local experts that we already have. I understand the German system is something like this, based on public sector skills and resources that already exist at the local level. Yeah. GPs, environmental health officers, public health workers, hospital and university labs, all of these local experts and resources have been ignored and sidelined by the Westminster government.
Yeah, and we should highlight there, it was one of those that you mentioned, public health. You know, the eroding of public health as that vitally important part of our health and care landscape over recent years. We've paid a heavy price for it over the past 6 months, Camilla.
Yes, we have, and you know, the writing was on the wall. I think, you know, we people forewarned of pandemics. We knew that there were potentially viruses that could be a cause of a pandemic, and yet the you know, pandemic preparedness was just not there. And you know, when the WHO raised the alarm in January, nothing was done, and those vital weeks that could have really allowed the UK and Wales to prepare weren't used appropriately, and that has paid a high price. As Alan said, the Westminster government has continually shown its incompetence and its undervaluing of public health expertise. Sadly.
Yeah. Listen, we're nearing the end of our time. What strikes me, we've had tragedy, we've had events that have changed the lives of individuals and families and communities over the past 6 months. But we have to look for positives from that adversity. And one thing that strikes me is that through this new realization, or the reminding ourselves of the importance of care and health, that this is a good time to make the kind of radical changes that Plaid Cymru is promoting now. I think people want it. I hope they don't have short memories. I don't think they will, because this has been a profound experience for all of us. But now is the time. So to wrap up, in that context, and the fact that the people are with us in wanting to bring about these changes, describe just very briefly, Camilla, that health and care service at the end of a first 5-year term of a Plaid government, and how we could really transform things in a short period of time.
Well, I think it is a really good time to, there's been the phrase going around, isn't there, about build back better. And I think it's better if we think of it as build forward better. It is the time for real change. And we've been shown that a decentralised system is what is needed now. And that Westminster doesn't speak for Wales. And Wales needs to be able to create a health and social care system that works for itself. And so I think that one of the things for me working globally around the pandemic, that the health systems and the care systems that have really shown themselves to be the best have been the well-funded and equitable systems. And that's what we need to look for. And the other thing I would say is that whatever country I've ever worked in, that health workers are the backbone of your health system. Yeah. And if you value them, then you will, have a good system. So, those are my parting thoughts.
We could have another debate on how workforce planning has just not been given the focus that it has in Wales for many years, and that's why we have so many depressed numbers of workers in key sectors, from nurses to doctors and right across the spectrum. Alan, describe that sort of vision of what things could be like in your mind in 5 years' time.
Well, firstly, we need to see prevention and well-being built in to our whole society, so that all sorts of policy areas contribute to that. And then for those that do become ill, we need to see a social care system delivered free at the point of need, just like health, and a single national health and social care service managed nationally, delivered locally, fully bilingual, with full parity of terms and conditions between health and social care workers.
Beautifully summed up. And for you, Leanne, as a politician, as somebody who has a political vision, and as somebody who works on the front line with a huge amount of pride, as you all do, in working, in caring for the patients, how do you see things and that vision of what things could be like compared with now?
I think I agree with everyone. Now is the time really to make some radical changes. I mean, we've had the NHS under a Labour government for 20 years. During my time, working within nursing, I've seen so many changes, so many sort of reconfigurations from NHS trusts to local health boards, back to health boards. You know, we had 21 local health boards, now we're down to 7. Each time, you know, government has promised us there's not going to be so much bureaucracy. There's more bureaucracy now than ever. You know, we've got managers managing managers. We've got nurses and staff, healthcare staff at breaking point. I mean, Wales, you know, we were the first country in Europe to bring in the NHS safe staffing levels, you know. But sadly, that's only within hospitals. You know, we need to have that. And again, it's only on the acute wards. We need that to be across the whole health and social care system, you know. Care homes, you know, care providers within the community. You know, they need to sort of they need to have that legislation, and the workers do, to protect them. And I think for me as well, one of the things that I would like to see is less bureaucracy, less management, and where there is poor management, then the managers are accountable for that. Be it through, you know, as a nurse, I'm accountable to the NMC. As a doctor, you know, Camilla's accountable to the GMC. You know, I think, you know, we need to have a system in place where, you know, senior managers are accountable, and they, you know, they have their own regulatory body.
Absolutely, and Plaid Cymru has said we would introduce a register of managers that are brilliant managers in the NHS.
Absolutely,
it's not right that they are tarred with you know, some people who aren't delivering. And you know, let's have a register and celebrate the excellence that there is within management as well as on the clinician clinical side. Leanne, diolch. Thank you for your contribution tonight, but also for your work. And
Thanks.
Please pass on our thanks to your colleagues. Camilla, diolch yn fawr iawn. Alun, diolch yn fawr iawn. Mae wedi bod drafodaeth ddifyr tu hwnt. Dechrau'r drafodaeth ydy hyn. Dwi'n edrych ymlaen i fod yn trafod, gobeithio, fel gweinidog iechyd a gofal yn sefydlu gwasanaeth iechyd a gofal cenedlaethol i Gymru ac yn trawsnewid yn gwasanaethau ni. Diolch am wylio, mwynhewch gweddill y Cynhadledd.
Wel, mi'n credu mae'n allweddol. Dwi'n credu bod ni'n cefnogi pobl ifanc ac yn gwrando ar eu lleisiau nhw. Mae'n gwych i weld gymaint o bobl ifanc wedi troi mas heddiw, ac fi'n mawr obeithio y bydd Llywodraeth Cymru yn gwrando ar bobl ifanc ac yn newid i polisi nhw o ran yr anghyfiawnder sydd wedi digwydd o ran graddau ac AS. Wel, byddwn ni gyda pobl ifanc pob cam o'r ffordd, ac byddwn ni'n defnyddio pob dull posib y gallwn ni roi pwysau ar Lywodraeth Cymru i wneud tro bedol fel sydd wedi digwydd yn yr Alban. Yr unig datrysiad teg ydy bod Llywodraeth Cymru a Cymru Cymru yn dychwelyd at graddau oedd wedi asesu yn wreiddiol gan athrawon. Ac i ni yn mawr obeithio y bydd Llywodraeth Cymru yn gwrando ar y lleisiau yma, ac byddwn ni'n defnyddio pob platform sydd gyda ni o fewn y Senedd a tu fas dros y dyddiau a'r wythnosau nesaf i sicrhau bod yna gyfiawnder yn digwydd i bobl ifanc. I'm here to show my support and solidarity with young people primarily who have been badly let down by the system, right across Wales really, and a terrible unfairness and injustice has happened, and we've got to do everything we can to put that right, because it's not just, of course, caused huge distress and anxiety on top of all the suffering that young people have had to face this tremendously difficult year already. But unless it's put right, of course, it will cast a shadow on those young people's lives. It will affect their life chances in their future, and we cannot allow that injustice to go on and have that kind of effect. It's amazing to see this turnout today from this rally organised by young people for young people, and I really hope that the Welsh Government is going to listen to the voices of the youth of Wales. I'd like to start my remarks with a word of apology to the young people of Wales on behalf of a system, a political system and an education system that failed them utterly last week. We haven't heard a word of apology yet from the Welsh Government, so I thought I'd give it for them. And as Kai said, if we were grading the Welsh Government on the way they've dealt with this scandal so far, then they have failed utterly. And the consequences of that failure has been felt, of course, keenly by thousands of young people all over Wales. Why is it that the Education Minister, the night before, put in place the so-called AS-level safety net, which actually just adds another tier of unfairness because it doesn't recognise the progress that students have made in Year 13? Why? Was the problem, then what we need is not a better appeals process. We need to change the system. Forcing the Education Minister and the First Minister are listening to us now, as I hope they are, then I want them to hear this more than anything. Forcing students to go through the pain and stress and delay of a complicated appeal system just to get them the grades already awarded to them by their teachers simply adds insult to injury to young people who suffered enough. We can and we must win this fight, because a nation that fails its young people is failing its own future. Let's win this for you and for the better country that we can be.
Dwi un o cydlynydd Porthu Pawb yn Gaernarfon, a da ni yma heddiw yn sefydlu'r gwasanaeth. Ar ôl chydig bach o meddwl a sgwrsio efo cynnyrchwyr lleol, nathon ni ddecidio i dechrau ar y gwasanaeth Porthu Pawb, lle oedden ni yn coginio a dosbarthu bwyd i'r henoed a bregus yn Gaernarfon. Mae'r gwasanaeth wedi tyfu wan, lle mae gennym ni fyny at 45-50 o bobl yn gwirfoddoli efo ni, ac da ni wan yn bwydo yr henoed ag yr plant yn Gaernarfon. Be nath wneud fi dewis i ymuno efo Plaid Cymru oedd y ffaith bod da ni rhannu yr un golwg ar sut a be bysa gora i'r gwlad a cymunedau yn Gymru. Prosiecta bach fel hyn yn wbath dwi dal yn agos i'n nghalon, lle mae cymunedau dod at ei gilydd a helpu ei gilydd. Mae y ffaith bod Plaid Cymru yn licio cymryd rhan yn hyn a helpu sefydlu yr prosiectau yn rhywbeth dwi'n parchu mor gymaint, felly oedd o'n dewis hawdd iawn i ymuno â Plaid Cymru.
Enw i di Nel.
Enw i Gwenira.
Da ni wedi bod yn ffeindio lot o lwybrau newydd rhwng Gaernarfon a da ni wedi bod yn porthi pawb ers cychwyn y lockdown.
Bron iawn.
Bron iawn ers cychwyn y lockdown. A da ni'n meddwl bod y bach yn dris bod ni ddim wedi bod yn neud hyn pan doedd na ddim crisis angen, achos ti'n sylweddoli bod rhai pobl angen bwyd. A da ni'n lwcus iawn bod ni'n gallu cael o'n hawdd.
Helo, Anna Jane, dwi wedi bod yn helpu efo cofis curo corona ers mis Mawrth yn delifro prescriptions i bobl ward Seiont. Dwi'n meddwl bod bobl ar y cyfan wedi bod yn hynod o ddiolchgar am yr help. Maen nhw'n gwerthfawrogi y ffaith bod yna gefnogaeth ar gael yn y gymuned. Nid yn unig o ran o prescriptions, ond o ran y gwasanaethau eraill hefyd, y siopa a'r dosbarthu prydau bwyd. Mae bob peth wedi bod yn helpu gynnal gobaith bobl yng nghanol y peth, a mae wedi bod yn helpu gynnal yng nghobaith i hefyd bod fi'n cael gwneud hyn. Mae Cai a Dic wedi bod yn hynod o effeithiol fel cynghorwyr ar ward Seiont. Hebddyn nhw a heb eu gwaith nhw fysa hyn ddim wedi bod yn bosib i wneud o gwbl. Maen nhw wedi'n nghefnogi fi fel gwirfoddolwraig a wedi cefnogi'r bobl ar y ward pa bynnag blaid ydyn nhw i gael y gwasanaethau maen nhw angen.
It's been fantastic to see the local communities coming together to help the most vulnerable within the communities. Lots of Plaid Cymru members have been involved in those kinds of activities, and it's been really encouraging to see that happen despite the circumstances that we're in. The communities have really worked well together.
Hello, my name's Chris and I'm one of the coordinators here of Porthi Pawb, and we're here today setting up one of our services. The idea at first was to cook and supply food to up to about 20-30 people here in Caernarfon. The service has grown so much, we now have up to 45 to 50 volunteers throughout the day, offering 2 services from feeding the elderly and vulnerable here in Caernarfon to all the kids as well. So I recently became a member of Plaid Cymru because I believe we share the same opinions on how Wales would develop better for the future. These little projects here are close to my heart, where little small communities are being helped. Either way, these are the projects that Plaid Cymru like to get involved in to make sure that the communities are safe and well, and I applaud that. So it made it an easy decision to become a member for Plaid Cymru.
We've been, since the start of the lockdown, we got involved with this scheme, which is Porthi Pawb in Caernarfon, and it's been really an eye-opening experience for us, certainly. I think in terms of where Plaid and the support in Caernarfon, not just to one scheme, but just the whole community, what they've done over pre-crisis, but certainly during the crisis, is just amazing. And the army of volunteers that Plaid have got that support this work is, you know, without them, this wouldn't happen.
I'm Anna Jane. I've been volunteering with Cofis Curo Corona since the beginning, delivering prescriptions in the Seiont ward. People have been very, very grateful. There's been a huge sense of relief, I think, that people are willing to help each other. There's been a very positive community spirit. It's not just the people delivering prescriptions. There's been a huge amount of other work going on as well that's given people hope in the middle of all this.
Ar ôl chydig bach o meddwl a sgwrsio efo'r cynnyrchwyr lleol, nathon ni ddecidio i dechrau ar y gwasanaeth Porthi Pawb lle oedden ni yn coginio a dosbarthu bwyd i'r henoed a bregus yn Gaernarfon. Mae'r gwasanaeth wedi tyfu wan lle mae gennym ni fyny at 45-50 o bobl yn gwirfoddoli efo ni ac da ni wan yn bwydo yr henoed ag yr plant yn Gaernarfon. Be nath wneud fi dewis i ymuno efo Plaid Cymru oedd y ffaith bod da ni rhannu yr un golwg ar sut a be bysa gorau i'r gwlad a cymunedau yn Gymru. Prosiecta bach fel hyn yn wbath dwi dal yn agos i'n nghalon lle mae cymunedau dod at ei gilydd a helpu ei gilydd. Mae y ffaith bod Plaid Cymru yn licio cymryd rhan yn hyn a helpu sefydlu yr prosiecta yn wbath dwi'n parchu mor gymaint, felly oedd o'n dewis hawdd iawn i ymuno â Plaid Cymru.
Enwi di Nel.
Enwi Benira.
Da ni wedi bod yn ffeindio lot o lwybrau newydd rhwng Gaernarfon a da ni wedi bod yn porthi pawb ers cychwyn y lockdown.
Bron iawn.
Bron iawn ers cychwyn y lockdown. A da ni'n meddwl bod y bach yn dris bod ni ddim wedi bod yn ei hyn pan doedd na ddim crisis angen, achos ti'n sylweddoli bod rhai pobl angen bwyd. A da ni'n lwcus iawn bod ni'n gallu cael o'n hawdd.
Bod y cynllun neges bod yn hynod o bwysig o ran dim oedd y prydau bwyd, pecynna bwyd yn darparu i'r teuluoedd bregus yma yn para wythnos iddyn nhw. Mae'n diolch ni'n enfawr hefyd i Tŷ Bwyta Dylan sy'n Mhorthaethwy oedd wedi gwirfoddoli hamsar gwerthfawr iawn i darparu bwyd ac gludo'r bwyd am ddim. Da ni lwcus iawn o hynny'n digwyr. Dwi'n meddwl bod o'n rhyw gylch perffaith o helpu unigolion a busnesau mewn adag mwyaf anodd i ni gyd.
Beth arall buon ni'n neud hefyd, wrth gwrs oedd yr Llywodraeth wedi cychwyn yr cynllun bocsys bwyd ar gyfer rheini oedd yn gorfod cysgodi a sicrhau bod ni'n cefnogi busnesau lleol ac llif bwyd lleol mwy nag oedden ni'n gallu mwyn sicrhau bod safon y bwyd yn well, bod yn fwy addas i'r unigolion oedd yn derbyn o, ac wrth gwrs fel o'n i'n deud yn cefnogi'r economi leol cymaint ag y gallen ni hefyd.
Hello, my name's Chris and I'm one of the coordinators here of Porthi Pawb, and we're here today setting up one of our services. The idea at first was to cook and supply food to up to about 20-30 people here in Caernarfon. The service has grown so much, we now have up to 45 to 50 volunteers throughout the day, offering 2 services from feeding the elderly and vulnerable here in Caernarfon to all the kids as well. So I recently became a member of Plaid Cymru because I believe we share the same opinions on how Wales would develop better for the future. These little projects here are close to my heart where small communities are being helped. Either way, these are the projects that Plaid Cymru like to get involved in to make sure that the communities are safe and well, and I applaud that, so it made it an easy decision to become a member for Plaid Cymru.
We've been, since the start of the lockdown, we got involved with this scheme, which is Porthi Pawb in Caernarfon, and it's been really an eye-opening experience for us, certainly. I think in terms of where Plaid and the support in Caernarfon, not just to one scheme, but just the whole community, what they've done over pre-crisis, but certainly during the crisis, is just amazing. And the army of volunteers that Plaid have got, that support this work, is, you know, without them, this wouldn't happen.
Neges was a scheme that we quickly again turned around. We wanted to help families that were struggling, couples and individuals that were struggling through this time. People had lost their work, were on furlough, on a lot less income coming in, obviously. So we tapped into a grant that we had, and we have spent £100,000 with local producers, and it's produced 3,500 meals over the past 4 months on Anglesey and in Gwynedd.
All the staff were reallocated to jobs that were front-facing and helping people out in the community. The food boxes, for example, have been delivered regularly over time. We've made sure as well during the setting up the scheme that we used local companies in order to provide the food in the boxes.
Cyngor a'r swyddogion yn gweithio ar cyngor wedi ymateb yn arbennig o reynus ag effeithiol i'r her coronavirus ac wedi gwneud hynny o'r cychwyn cyntaf. Penderfyniadau cynnar iawn gan y cyngor yma wedi bod yn hynod o effeithiol yn gwarchod yr ardal rhag caniatáu i'r feirws i ledu. Penderfyniad tebyg i warchod yn cartrefi hen bobl ni, gosod protocol cynnar iawn mewn lle i ddiogelu'r cartrefi hynny. Cyn gadael i'r feirws i gydio yn cymunedau ni i fod yn edrych i weld le oedd yr feirws, pwy oedd yn positif ac yna cofnodi a olrhain rheini a hunan ynysu le oedd angen. Ac felly nath hwnna ganiatáu i'r feirws i beidio cymryd gafel yn lot fawr o'n cymunedau ni yma yng Ngheredigion ac fe oedd yr cyngor sir a'i gweithredoedd nhw yn allweddol i sicrhau fod hynny'n digwydd.
Reit ar dechrau'r clo mawr, rwy'n credu y peth cyntaf oedd ar yn meddyliau ni oedd lleihau'r boblogaeth, achos trwy cydweithio gyda'r gwasanaeth iechyd yn lleol, oedden ni'n gwybod, a ddeud y gwir, bod gyda nhw ddim o'r capacity i allu delio gyda'r beth oedd wedi cael ei modelu ar yn cyfer ni gallai fod yn digwydd. Mi fuon ni'n gweithio'n galed yn fewnol gyda'n cartrefi preswyl er enghraifft. Cartrefi preswyl ni, roedd y protocol llym yn ei le i sicrhau nad oedd pobl ddim yn gallu mynd a dod allan o'r cartrefi heb bod nhw'n dilyn protocol cadarn. A diolch byth, mi oedd hwnna'n golygu bod ni ddim wedi colli neb allan o dim un o cartrefi preswyl Ceredigion. Beth arall y buon ni'n wneud hefyd, wrth gwrs oedd yr Llywodraeth wedi cychwyn yr cynllun bocsys bwyd ar gyfer rheini oedd yn gorfod cysgodi a sicrhau bod ni'n cefnogi busnesau lleol ac llif bwyd lleol mwy nag oedden ni'n gallu mwyn sicrhau bod safon y bwyd yn well, bod yn fwy addas i'r unigolion oedd yn derbyn o, ac wrth gwrs fel o'n i'n dweud yn cefnogi'r economi leol cymaint ag y gallen ni hefyd.
We found here in Ceredigion that the council took very early action. It decided to have a very tight protocol on protecting its old people's homes, and then the disease wasn't present in Ceredigion very early, and therefore the council decided it wasn't just going to wait until coronavirus appeared in Ceredigion. It decided to instigate a track and trace process so that any disease outbreaks were clamped down very early on in Ceredigion, and that kept the numbers of disease cases here very low right throughout.
I think initially the first thing that happened was that we worked very closely with the university and were able to make sure that most of the students went home in order to keep them safe. Following that initial step, the second thing we did was to cocoon our care homes and make sure that people did not go in and out inadvertently. They had to follow a definite protocol, and that protocol was shared with the private homes in the county. And thank goodness, up until now, when it's now middle of August, we haven't lost anybody from any of the homes in Ceredigion. Subsequent to that, all the staff were reallocated to jobs that were front-facing and helping people out in the community. The food boxes, for example, have been delivered regularly over time. When we came to the beginning of the tourist season, when things were beginning to open up, we realised that it wouldn't be easy to have a huge increase in population again with tourists. What we have done then is to pedestrianise some of the main routes in town, especially the routes where we've got local businesses, the cafes, restaurants, pubs. We have been out to consultation, and as I understand it, there have been about 900 responses, most of them being very supportive of what we've done.
How many of you are angry that the system has let you down? I hear you. I stand with you. Adam Price stands with you. Plaid Cymru stands with you, and we will fight with you to get this injustice rectified. I come from a family of teachers. My mother was a teacher, 2 of my grandparents were teachers, and they instilled in me a sense that there is nothing I couldn't do if I worked hard. But last week, people in my area were told that it didn't matter how hard they had worked. An algorithm knew better. It's no coincidence that in Welsh, the word ysgol means school, and also ladder. Education is hope. It is possibility. But last week, people from my area, many of whom are here today, were told that their teachers' grades didn't matter. They couldn't possibly be that good. Where they were from put a ceiling over their head. So don't try telling me about the integrity of your system, Mr. Drakeford. Don't try justifying what's happened. Think instead of the virtue of doing what is right, of letting our young people prosper. No one will blame you, Mr. Drakeford, if you change your mind now and do the right thing. What's happened in Scotland has shown that. And I'll end by saying that to those of you affected by this, remember, you are so much more than what has happened to you. You are not alone, and we will fight this with you every step of the way. Diolch yn fawr.
Mae argyfwng Covid wedi dangos i ni wir werth Cymdeithas Deg. Un sy'n gofalu am ei phobl bob cam o'i bywydau, ein plant, ein henoed, y sâl a'r gwan. Ond mae Covid hefyd wedi dinoethi yr anghyfiawnderau sydd yn llechu yn ein cymdeithas. Mae'r plota yn ein cymdeithas ni wedi dioddau fwyaf, yn ddwywaith fwy tebygol o farw o'r feirws, a mae'r bwlc cyrhaeddiant rhwng y cyfoethog a'r tlawd wedi gweithygu a'n plant ni wedi cael ei gadael ar ôl. Fe safon ni gyda'n gilydd bob wythnos i roi cymeradwyaeth i'n gweithwyr gofal, ac eto i gyd, maen nhw'n dal i aros am eu codiad cyflog. Mae goblygiadau methiant llafur i daclo tlodi yn glir. Ar ôl 20 mlynedd o lywodraeth llafur, mae 200,000 o blant yng Nghymru yn parhau i fyw mewn clodi, bron i dreian. Mae hyn yn felltith ar ein cymdeithas ac yn rhywbeth rwy'n benderfynol o'i newid, gyda thaliad plant o 35 punt yr wythnos wedi dargedu at y teuluoedd hynny sy'n gorfod penderfynu rhwng cynhesu'r catre a bwydo eu plant. Byddai ein cynnig gofal plant yn rhoi hwb i incwm miloedd o gartrefi ledled Cymru, gan ganiatáu rieni sydd ddim yn gweithio i ddychwelyd i'r gweithle a chreu hyd at 3,000 o swyddi newydd. A byddai Gwasanaeth Gofal Cenedlaethol Newydd Sbon yn gwneud Cymru yn genedl ofalgar, gan werthfawrogi yn staff gofal drwy roi iddynt gyflogaeth sy'n gyfystyr a rai yn gwasanaeth iechyd, gan wneud gofal cymdeithasol yn rad ac am ddim yn ôl yr angen. Rwyf am arwain llywodraeth ar gyfer pob cenedlaeth. Llywodraeth sy'n cyflawni newid radical mwyn y miloedd o deuluoedd sydd angen gweld y newid hwnnw. Rwyf am i mab i dyfu lan mewn gwlad lle mae tlodi yn atgof pell oherwydd bod ni wedi meiddio credu nad oes unrhyw her yn rhy fawr i'w goresgyn. Etholiad 2021 yw'n cyfle ni i weld newid go iawn a roi ar waith yr hyn mae'r Llywodraeth bresennol wedi methu i chyflawni. Os i ni am weld newid, daw newid. Ond mae'n dechrau gyda ni, drwy weithio gyda'n gilydd dros Gymru. If the COVID crisis has taught us anything, it is this. The sign of a decent society is how we treat people at the dawn of their lives, our children, at the twilight of their lives, our elderly, and in the shadow of their lives, the sick and the needy. But this crisis has demonstrated too that we've not all been in this together in the same way equally. The poorest in our communities have been the hardest hit, twice as likely to die from the disease. The educational attainment gap between the rich and the poor has grown even further, with many of our children falling further behind. And though we've clapped our carers every week, they are still amongst the lowest paid in our society. The pandemic has laid bare the consequences of abandoning targets for ending poverty. After 20 years of a Labour-led government, there are still 200,000 children living in poverty in Wales. A third of our children living in poverty is a blight on our communities, and something I am determined to change with a £35 a week child payment targeted at families who have to decide between heating the home and feeding the children. Our childcare offer would boost the incomes of thousands of households, allowing non-working parents back into the workplace and create up to 3,000 new jobs. And a brand new national care service would make Wales the caring nation, valuing our care staff with salaries comparable with the NHS and making social care free at the point of delivery. I want to lead a government for all generations, a government delivering radical change, not for change's sake, but for the sake of the thousands of families whose futures rest on it. I want my son to grow up in a country where poverty is a distant memory, thanks to a belief that there is no challenge too big to overcome. It can change, if we want it to change, but the change must start with us. In the shadow of this pandemic, ask not what you can do for your country. Ask not what Wales can do for you. Ask what we can do together for each other.
Angylion wrth fy ngwely. Ar awr enbyd bywyd, bu angylion wrth fy ngwely. Yn fy ing mae fy angel yn estyn llaw fach dawel a dweud â gwen, un diwrnod, gwn y dawr wawr dros y gorwel. Eto henon tywyni'n llaw nawdd i fy llonyddu, yn y tŷ neu'r ysbyty, bydd fy angel wrth fy ngwely. Angel dawel ydy hon, yn wylaidd mewn treialon. Mae hi'n wen dwy mewn enid di, mae hael hyd ei hymylon. Yn fy ing mae fy angel, yn estyn llaw fach dawel, a dweud â gwen, un diwrnod, gwn y dawr wawr dros y gorwel.
Thursday evening, startled from the lull by fireworks, pots and pans, flesh on flesh, cries of gratitude. A vacuum in the silence that follows. Hands wiping down railings, hands spraying clouds of lemon, hands scrubbing, hands stiffening, hands aching with care. Little rainbows of hope in the net-curtained windows, the brilliant yellow arc of paint falling like the cautions you have given us so often. You need more funding, more staff, more training, more time. Cautions battered aside, neglected, fading like the foot of a rainbow in a cloud. The simplest things, paper towels, masks, gloves, absent, like your pay increase, like the promise of safety. And yet, despite the incompetence, the pain, the anger, the danger, the fear, you decide to be the best of us. Doctors, nurses, cleaners, carers. To you we owe our safety, our lives. Our thanks can never be enough, should never be enough. Beyond the applause, here's a true show of appreciation. Fair pay and safety, an end to underfunding, a vow to never privatise, never compromise the cause to which you have dedicated yourselves, our fragile, precious lives.
Yn fuan iawn o mis Mawrth, othon ni a grŵp at ei gilydd, Menter Môn a Medrwn Môn, dyma nhw grwpio cymunedol i ni fedru cydgordio be oedd ei hangen yn y gymdeithas, ac o rhaid wneud y siŵr bod na ddim un cymdeithas yn Ynys Môn ddim yn cael ei ddiogelu. Mi oedd gennym ni dros 800 o wirfoddolwyr yn barod i wasanaethu'r Ynys. Mi oedd Menter Môn yn arwain ar sefydlu bancia bwyd ar y cyd efo'r cyngor. Da ni wedi gwneud lot fawr o waith mewn cyfnod byr mwyn diogelu bobl yr Ynys. Ond eto, mae yna waddol yma wrth symud ymlaen. Mae gennym ni sylfaen cadarn wrth symud ymlaen.
Well, I've been in business for 35 years, and what happened on the 20th of March kind of took everybody's breath away, didn't it? It was a kind of life-changing moment, really, for everyone. You know, we were hearing about nurses and doctors not having access to a hot meal at work. We were hearing about members of the community unable to feed themselves, shortages of food, and, you know, what we have here is a fantastic resource, you know, somewhere where we can cook thousands and thousands of meals. And very quickly it was apparent there were lots of people like us with similar, you know, kind of needs to help, and we got together very quickly and set up this wonderful project called Neges, which is, you know, if you're looking for an example of how a community pulls together in a crisis, you know, Neges is just the kind of gold standard for cooperation, collaboration and support within a community.
Bod y cynllun neges bod yn hynod o bwysig o ran dim oedd y prydau bwyd, pecynau bwyd yn darparu i'r teuluoedd bregus yma yn para wythnos iddyn nhw. Mae'n diolch ni'n enfawr hefyd i Tŷ Bwyta Dylan sy'n Mhorthaethwy oedd wedi gwirfoddoli hamsar gwerthfawr iawn i darparu bwyd ac gludo'r bwyd am ddim o'i safle bwyd yma Llangefni. Wedyn dwi'n meddwl bod na ryw gylch perffaith ddweud y gwir o cynnyrch bwyd, prynu'r cynnyrch yn lleol gan fudiadau, gan fusnesau fatha Halen Môn, Hufenfa de Arfon. Felly, da ni lwcus iawn o hynny'n ddweud y gwir. Dwi'n meddwl bod o'n rhyw gylch perffaith o helpu unigolion a busnesau mewn adag mwyaf anodd i ni gyd.
Work was extremely important, and at the beginning of March I brought Menter Môn and Medrwn Môn together. Medrwn Môn is the volunteer sector here in Ynys Môn, and Menter Môn is there to support the economy here locally. We were able to get over 800 volunteers here in Ynys Môn. We made sure that all the communities were covered by volunteers, and those volunteers then went out and food deliveries, prescriptions, anything that was needed of them, they have delivered. We were also able to have a few pop-up food banks set up here on the island. That was with the housing staff in the council and volunteers, and the housing staff have and all staff have been delivering PPE out to our residential care homes and nursing homes on the island. So we've actually adapted quickly to make sure that everybody was covered and that everybody felt safe here.
Well, I've been in business for 35 years, and what happened on the 20th of March kind of took everybody's breath away, didn't it? It was a kind of life-changing moment, really, for everyone. You know, we were hearing about nurses and doctors not having access to a hot meal at work. We were hearing about members of the community unable to feed themselves, shortages of food, and, you know, what we have here is a fantastic resource, you know, somewhere where we can cook thousands and thousands of meals. And very quickly it was apparent there were lots of people like us with similar, you know, kind of needs to help, and we got together very quickly and set up this wonderful project called Neges, which is, you know, if you're looking for an example of how a community pulls together in a crisis, you know, Neges is just the kind of gold standard for cooperation, collaboration and support within a community.
Neges was a scheme that we quickly again turned around. We wanted to help families that were struggling, couples and individuals that were struggling through this time. People had lost their work, were on furlough, on a lot less income coming in obviously. So we tapped into a grant that we had, and we have spent £100,000 with local producers, and it's produced 3,500 meals over the past 4 months on Anglesey and in Gwynedd.
I'm here in Edward Street talking to the residents here about their experience with the terrible flooding we had earlier this year. And, you know, it's really kind of heart-wrenching, to be honest with you, to hear the situation of many of the families here, many of whom are still now struggling to put things back in order, really.
The insurance people started to take the house apart before the lockdown, the day before the lockdown, taking stuff off the walls, skirting boards, architrave, etc. As you see, it's been stripped back now. It's been like this for 8 months. I have a dehumidifier here. I'm getting through about 1.5 buckets of water a day. The same here in this area. I have taken the paper off the walls, so it's starting to stink. As you see it, that's the way I'm living for the last 8 months. Come on through to the kitchen. I built this kitchen myself, and then when the guy came, of course, it all had to go. So now I'm back to square one again. Well, I have nothing. I have a stove and a sideboard as a countertop, thankfully. But as you see, I am living like this.
It was raining in the evening one night in the night, and I know I looked out of the window in the bedroom and it was raining, but it was quiet. Well, the next thing is I looked out and every car in the street was underwater. Gutted, and if I can use the word. I want somebody to wave a magic wand, you know, I'd wake up in the morning and think, oh God, I've got carpets.
And this problem is only going to get worse, of course, sadly, as a result of climate change. So this has to become an absolute priority for us in Wales. We're a rainy country with lots of mountains. You know, it's a no-brainer that we've got to invest here, and we've got to invest hard, and we've got to do it quickly. And while we're doing it, we've got to protect those families that are currently uninsured by the market.
It's the fear of it every time it rains. It's so destroying, it's so destroying.
Wel, mi'n credu mae'n allweddol. Dwi'n credu bod ni'n cefnogi pobl ifanc ac yn gwrando ar eu lleisiau nhw. Mae'n gwych i weld gymaint o bobl ifanc wedi troi mas heddiw, ac fi'n mawr obeithio y bydd Llywodraeth Cymru yn gwrando ar bobl ifanc ac yn newid i polisi nhw o ran yr anghyfiawnder sydd wedi digwydd o ran graddau ac AS. Wel, byddwn ni gyda pobl ifanc pob cam o'r ffordd, ac byddwn ni'n defnyddio pob dull posib y gallwn ni roi pwysau ar Lywodraeth Cymru i wneud tro bedol fel sydd wedi digwydd yn yr Alban. Yr unig datrysiad teg ydy bod Llywodraeth Cymru a Cymru Cymru yn dychwelyd at y graddau oedd wedi asesu yn wreiddiol gan athrawon. Ac i ni yn mawr obeithio y bydd Llywodraeth Cymru yn gwrando ar y lleisiau yma, ac byddwn ni'n defnyddio pob platform sydd gyda ni o fewn y Senedd a tu fas dros y dyddiau a'r wythnosau nesaf i sicrhau bod yna gyfiawnder yn digwydd i bobl ifanc. I'm here to show my support and solidarity with young people primarily who have been badly let down by the system, right across Wales really, and a terrible unfairness and injustice has happened, and we've got to do everything we can to put that right, because it's not just, of course, caused huge distress and anxiety on top of all the suffering that young people have had to face this tremendously difficult year already. But unless it's put right, of course, it will cast a shadow on those young people's lives. It will affect their life chances in their future, and we cannot allow that injustice to go on and have that kind of effect. It's amazing to see this turnout today from this rally organised by young people for young people, and I really hope that the Welsh Government is going to listen to the voices of the youth of Wales. I'd like to start my remarks with a word of apology to the young people of Wales on behalf of a system, a political system and an education system that failed them utterly last week. We haven't heard a word of apology yet from the Welsh Government, so I thought I'd give it for them. And as Kai said, if we were grading the Welsh Government on the way they've dealt with this scandal so far, then they have failed utterly. And the consequences of that failure has been felt, of course, keenly by thousands of young people all over Wales. Why is it that the Education Minister, the night before, put in place the so-called AS-level safety net, which actually just adds another tier of unfairness because it doesn't recognise the progress that students have made in Year 13? Why? Was the problem, then what we need is not a better appeals process. We need to change the system. Forcing the Education Minister and the First Minister are listening to us now, as I hope they are, then I want them to hear this more than anything. Forcing students to go through the pain and stress and delay of a complicated appeal system just to get them the grades already awarded to them by their teachers simply adds insult to injury to young people who suffered enough. We can and we must win this fight, because a nation that fails its young people is failing its own future. Let's win this for you and for the better country that we can be.
Dwi un o cydlynydd Porthu Pawb yn Gaernarfon, a da ni yma heddiw yn sefydlu'r gwasanaeth. Ar ôl chydig bach o meddwl a sgwrsio efo'r cynnyrchwyr lleol, nathon ni ddecidio i dechrau ar y gwasanaeth Porthu Pawb, lle oedden ni yn coginio a dosbarthu bwyd i'r henoed a bregus yn Gaernarfon. Mae'r gwasanaeth wedi tyfu wan, lle mae gennym ni fyny at 45-50 o bobl yn gwirfoddoli efo ni, ac da ni wan yn bwydo yr henoed ag yr plant yn Gaernarfon. Be nath wneud fi dewis i ymuno efo Plaid Cymru oedd y ffaith bod da ni rhannu yr un golwg ar sut a be bysa gora i'r gwlad a cymunedau yn Gymru. Prosiecta bach fel hyn yn wbath dwi dal yn agos i'n nghalon, lle mae cymunedau dod at ei gilydd a helpu ei gilydd. Mae y ffaith bod Plaid Cymru yn licio cymryd rhan yn hyn a helpu sefydlu yr prosiectau yn rhywbeth dwi'n parchu mor gymaint, felly oedd o'n dewis hawdd iawn i ymuno â Plaid Cymru.
Enwi di Nel.
Enwi di Benira.
Da ni wedi bod yn ffeindio lot o lwybrau newydd rhwng Gaernarfon a da ni wedi bod yn porthi pawb ers cychwyn y lockdown.
Bron iawn.
Bron iawn ers cychwyn y lockdown. A da ni'n meddwl bod y bach yn dris bod ni ddim wedi bod yn neud hyn pan doedd na ddim crisis angen, achos ti'n sylweddoli bod rhai pobl angen bwyd. A da ni'n lwcus iawn bod ni'n gallu cael o'n hawdd.
Helo, Anna Jane, dwi wedi bod yn helpu efo cofis curo corona ers mis Mawrth yn delifro prescriptions i bobl ward Seiont. Dwi'n meddwl bod bobl ar y cyfan wedi bod yn hynod o ddiolchgar am yr help. Maen nhw'n gwerthfawrogi y ffaith bod yna gefnogaeth ar gael yn y gymuned. Nid yn unig o ran o prescriptions, ond o ran y gwasanaethau eraill hefyd, y siopa a'r dosbarthu prydau bwyd. Mae bob peth wedi bod yn helpu gynnal gobaith bobl yng nghanol y peth, a mae wedi bod yn helpu gynnal yng nghobaith i hefyd bod fi'n cael gwneud hyn. Mae Cai a Dic wedi bod yn hynod o effeithiol fel cynghorwyr ar ward Seiont. Hebddyn nhw a heb eu gwaith nhw fysa hyn ddim wedi bod yn bosib i wneud o gwbl. Maen nhw wedi'n nghefnogi fi fel gwirfoddolwraig a wedi cefnogi'r bobl ar y ward a bynnag blaid ydyn nhw i gael y gwasanaethau maen nhw angen.
It's been fantastic to see the local communities coming together to help the most vulnerable within the communities. Lots of Plaid Cymru members have been involved in those kinds of activities, and it's been really encouraging to see that happen despite the circumstances that we're in. The communities have really worked well together.
Hello, my name's Chris and I'm one of the coordinators here of Porthi Pawb, and we're here today setting up one of our services. The idea at first was to cook and supply food to up to about 20-30 people here in Caernarfon. The service has grown so much, we now have up to 45 to 50 volunteers throughout the day, offering 2 services from feeding the elderly and vulnerable here in Caernarfon to all the kids as well. So I recently became a member of Plaid Cymru because I believe we share the same opinions on how Wales would develop better for the future. These little projects here are close to my heart, where little small communities are being helped. Either way, these are the projects that Plaid Cymru like to get involved in to make sure that the communities are safe and well, and I applaud that. So it made it an easy decision to become a member for Plaid Cymru.
We've been, since the start of the lockdown, we got involved with this scheme, which is Porthi Pawb in Caernarfon, and it's been really an eye-opening experience for us, certainly. I think in terms of where Plaid and the support in Caernarfon, not just to one scheme, but just the whole community, what they've done over pre-crisis, but certainly during the crisis, is just amazing. And the army of volunteers that Plaid have got that support this work is, you know, without them, this wouldn't happen.
I'm Anna Jane. I've been volunteering with Cofis Curo Corona since the beginning, delivering prescriptions in the Seiont ward. People have been very, very grateful. There's been a huge sense of relief, I think, that people are willing to help each other. There's been a very positive community spirit. It's not just the people delivering prescriptions. There's been a huge amount of other work going on as well that's given people hope in the middle of all this.
Ar ôl chydig bach o meddwl a sgwrsio efo'r cynnyrchwyr lleol, nathon ni ddecidio i dechrau ar y gwasanaeth Porthi Pawb lle oedden ni yn coginio a dosbarthu bwyd i'r henoed a bregus yn Gaernarfon. Mae'r gwasanaeth wedi tyfu wan lle mae gennym ni fyny at 45-50 o bobl yn gwirfoddoli efo ni ac da ni wan yn bwydo yr henoed ag yr plant yn Gaernarfon. Be nath wneud fi dewis i ymuno efo Plaid Cymru oedd y ffaith bod da ni rhannu yr un golwg ar sut a be bysa gorau i'r gwlad a cymunedau yn Gymru. Prosiecta bach fel hyn yn wbath dwi dal yn agos i'n halon lle mae cymunedau dod at ei gilydd a helpu ei gilydd. Mae y ffaith bod Plaid Cymru yn licio cymryd rhan yn hyn a helpu sefydlu yr prosiecta yn wbath dwi'n parchu mor gymaint, felly oedd o'n dewis hawdd iawn i ymuno â Plaid Cymru.
Enw i di Nel. Enw i Benira. Da ni wedi bod yn ffeindio lot o lwybrau newydd rhwng Gaernarfon a da ni wedi bod yn porthi pawb ers cychwyn y lockdown. Bron iawn. Bron iawn ers cychwyn y lockdown. A da ni'n meddwl bod y bach yn drist bod ni ddim wedi bod yn neud hyn pan doedd na ddim crisis angen, achos ti'n sylweddoli bod rhai pobl angen bwyd. A da ni'n lwcus iawn bod ni'n gallu cael o'n hawdd.
Bod y cynllun neges bod yn hynod o bwysig o ran oedd y prydau bwyd, pecynna bwyd yn darparu i'r teuluoedd bregus yma yn para wythnos iddyn nhw. Mae'n diolch ni'n enfawr hefyd i Tŷ Bwyta Dylan sy'n Mhorthaethwy oedd wedi gwirfoddoli hamsar gwerthfawr iawn i darparu bwyd ac gludo'r bwyd am ddim. Da ni lwcus iawn o hynny'n digwyr. Dwi'n meddwl bod o'n rhyw gylch perffaith o helpu unigolion a busnesau mewn adag mwyaf anodd i ni gyd.
Beth arall buon ni'n neud hefyd, wrth gwrs oedd yr Llywodraeth wedi cychwyn y cynllun bocsys bwyd ar gyfer rheini oedd yn gorfod cysgodi a sicrhau bod ni'n cefnogi busnesau lleol ac llif bwyd lleol mwy nag oedden ni'n gallu mwyn sicrhau bod safon y bwyd yn well, bod yn fwy addas i'r unigolion oedd yn derbyn o, ac wrth gwrs fel o'n i'n deud yn cefnogi'r economi leol cymaint ag y gallen ni hefyd.
Hello, my name's Chris and I'm one of the coordinators here of Porthi Pawb, and we're here today setting up one of our services. The idea at first was to cook and supply food to up to about 20-30 people here in Caernarfon. The service has grown so much, we now have up to 45 to 50 volunteers throughout the day, offering 2 services from feeding the elderly and vulnerable here in Caernarfon to all the kids as well. So I recently became a member of Plaid Cymru because I believe we share the same opinions on how Wales would develop better for the future. These little projects here are close to my heart where small communities are being helped. Either way, these are the projects that Plaid Cymru like to get involved in to make sure that the communities are safe and well, and I applaud that, so it made it an easy decision to become a member for Plaid Cymru.
We've been, since the start of the lockdown, we got involved with this scheme, which is Porthi Pawb in Caernarfon, and it's been really an eye-opening experience for us, certainly. I think in terms of where Plaid and the support in Caernarfon, not just to one scheme, but just the whole community, what they've done over pre-crisis, but certainly during the crisis, is just amazing. And the army of volunteers that Plaid have got, that support this work, is, you know, without them, this wouldn't happen.
Neges was a scheme that we quickly again turned around. We wanted to help families that were struggling, couples and individuals that were struggling through this time. People had lost their work, were on furlough, on a lot less income coming in, obviously. So we tapped into a grant that we had, and we have spent £100,000 with local producers, and it's produced 3,500 meals over the past 4 months on Anglesey and in Gwynedd.
All the staff were reallocated to jobs that were front-facing and helping people out in the community. The food boxes, for example, have been delivered regularly over time. We've made sure as well during the setting up the scheme that we used local companies in order to provide the food in the boxes.
Cyngor a'r swyddogion yn gweithio ar cyngor wedi ymateb yn arbennig o reynus ag effeithiol i'r her coronavirus ac wedi gwneud hynny o'r cychwyn cyntaf. Penderfyniadau cynnar iawn gan y cyngor yma wedi bod yn hynod o effeithiol yn gwarchod yr ardal rhag caniatáu i'r feirws i ledu. Penderfyniad tebyg i warchod yn cartrefi hen bobl ni, gosod protocol cynnar iawn mewn lle i ddiogelu'r cartrefi hynny. Cyn gadael i'r feirws i gydio yn cymunedau ni i fod yn edrych i weld le oedd yr feirws, pwy oedd yn positif ac yna cofnodi a olrhain rheini a hunan ynysu le oedd angen. Ac felly nath hwnna ganiatáu i'r feirws i beidio cymryd gafel yn lot fawr o'n cymunedau ni yma yng Ngheredigion ac fe oedd yr cyngor sir a'i gweithredoedd nhw yn allweddol i sicrhau fod hynny'n digwydd.
Reit ar dechrau'r clo mawr, rwy'n credu y peth cyntaf oedd ar yn meddyliau ni oedd lleihau'r boblogaeth, achos trwy cydweithio gyda'r gwasanaeth iechyd yn lleol, oedden ni'n gwybod, a ddeud y gwir, bod gyda nhw ddim o'r capacity i allu delio gyda'r beth oedd wedi cael ei modelu ar yn cyfer ni gallai fod yn digwydd. Mi fuon ni'n gweithio'n galed yn fewnol gyda'n cartrefi preswyl er enghraifft. Cartrefi preswyl ni, roedd y protocol llym yn ei le i sicrhau nad oedd pobl ddim yn gallu mynd a dod allan o'r cartrefi heb bod nhw'n dilyn protocol cadarn. A diolch byth, mi oedd hwnna'n golygu bod ni ddim wedi colli neb allan o dim un o cartrefi preswyl Ceredigion. Beth arall y buon ni'n wneud hefyd, wrth gwrs oedd yr Llywodraeth wedi cychwyn yr cynllun bocsys bwyd ar gyfer rheini oedd yn gorfod cysgodi a sicrhau bod ni'n cefnogi busnesau lleol ac llif bwyd lleol mwy nag oedden ni'n gallu mwyn sicrhau bod safon y bwyd yn well, bod yn fwy addas i'r unigolion oedd yn derbyn o ac wrth gwrs fel o'n i'n dweud yn cefnogi'r economi leol cymaint ag y gallen ni hefyd. We found here in Ceredigion that the council took very early action. It decided to have a very tight protocol on protecting its old people's homes, and then the disease wasn't present in Ceredigion very early, and therefore the council decided it wasn't just going to wait until coronavirus appeared in Ceredigion. It decided to instigate a track and trace process so that any disease outbreaks were clamped down very early on in Ceredigion, and that kept the numbers of disease cases here very low right throughout. I think initially the first thing that happened was that we worked very closely with the university and were able to make sure that most of the students went home in order to keep them safe. Following that initial step, the second thing we did was to cocoon our care homes and make sure that people did not go in and out inadvertently. They had to follow a definite protocol, and that protocol was shared with the private homes in the county. And thank goodness, up until now, when it's now middle of August, we haven't lost anybody from any of the homes in Ceredigion. Subsequent to that, all the staff were reallocated to jobs that were front-facing and helping people out in the community. The food boxes, for example, have been delivered regularly over time. When we came to the beginning of the tourist season, when things were beginning to open up, we realised that it wouldn't be easy to have a huge increase in population again with tourists. What we have done then is to pedestrianise some of the main routes in town, especially the routes where we've got local businesses, the cafes, restaurants, pubs. We have been out to consultation, and as I understand it, there have been about 900 responses, most of them being very supportive of what we've done.
How many of you are angry that the system has let you down? I hear you. I stand with you. Adam Price stands with you. Plaid Cymru stands with you. And we will fight with you to get this injustice rectified. I come from a family of teachers. My mother was a teacher, 2 of my grandparents were teachers, and they instilled in me a sense that there is nothing I couldn't do if I worked hard. But last week, people in my area were told that it didn't matter how hard they had worked. An algorithm knew better. It's no coincidence that in Welsh, the word ysgol means school, and also ladder. Education is hope. It is possibility. But last week, people from my area, many of whom are here today, were told that their teachers' grades didn't matter. They couldn't possibly be that good. Where they were from put a ceiling over their head. So don't try telling me about the integrity of your system, Mr. Drakeford. Don't try justifying what's happened. Think instead of the virtue of doing what is right, of letting our young people prosper. No one will blame you, Mr. Drakeford, if you change your mind now and do the right thing. What's happened in Scotland has shown that. And I'll end by saying that to those of you affected by this, remember, you are so much more than what has happened to you. You are not alone, and we will fight this with you every step of the way. Diolch yn fawr.
Gyfwng Covid wedi dangos i ni wir werth Cymdeithas Deg. Un sy'n gofalu am ei phobl bob cam o'i bywydau, ein plant, ein henoed, y sâl a'r gwan. Ond mae Covid hefyd wedi dinoethi yr anghyfiawnderau sydd yn llechu yn ein cymdeithas.
Mae'r plota yn ein cymdeithas ni wedi dioddau fwyaf, yn ddwywaith fwy tebygol o farw o'r feirws, a mae'r bwlc cyrhaeddiant rhwng y cyfoethog a'r tlawd wedi gweithygu am plant ni wedi cael ei gadael ar ôl. Fe safon ni gyda'n gilydd bob wythnos i roi cymeradwyaeth i'n gweithwyr gofal, ac eto i gyd, maen nhw'n dal i aros am eu codiad cyflog.
Mae goblygiadau methiant llafur i daclo tlodi yn glir. Ar ôl 20 mlynedd o lywodraeth llafur, mae 200,000 o blant yng Nghymru yn parhau i fyw mewn clodi, bron i dreian. Mae hyn yn felltith ar ein cymdeithas ac yn rhywbeth rwy'n benderfynol o'i newid, gyda thaliad plant o 35 yr wythnos wedi dargedu at y teuluoedd hynny sy'n gorfod penderfynu rhwng cynhesu'r cartre a bwydo eu plant. Byddai ein cynnig gofal plant yn rhoi hwb i incwm miloedd o gartrefi ledled Cymru, gan ganiatáu rieni sydd ddim yn gweithio i ddychwelyd i'r gweithle a chreu hyd at 3,000 o swyddi newydd. A byddai Gwasanaeth Gofal Cenedlaethol Newydd Sbon yn gwneud Cymru yn genedl ofalgar, gan werthfawrogi yn staff gofal drwy roi iddynt gyflogaeth sy'n gyfystyr a rai yn gwasanaeth iechyd, gan wneud gofal cymdeithasol yn rad ac am ddim yn ôl yr angen. Rwyf am arwain llywodraeth ar gyfer pob cenedlaeth. Llywodraeth sy'n cyflawni newid radical mwyn y miloedd o deuluoedd sydd angen gweld y newid hwnnw.
Rwyf am i mab i dyfu lan mewn gwlad lle mae tlodi yn atgof pell oherwydd bod ni wedi meiddio credu nad oes unrhyw her yn rhy fawr i'w goresgyn. Etholiad 2021 yw'n cyfle ni i weld newid go iawn a roi ar waith yr hyn mae'r llywodraeth bresennol wedi methu i chyflawni. Os i ni am weld newid, daw newid. Ond mae'n dechrau gyda ni, drwy weithio gyda'n gilydd dros Gymru.
If the COVID crisis has taught us anything, it is this. The sign of a decent society is how we treat people at the dawn of their lives, our children, at the twilight of their lives, our elderly, and in the shadow of their lives, the sick and the needy. But this crisis has demonstrated too that we've not all been in this together in the same way equally.
The poorest in our communities have been the hardest hit, twice as likely to die from the disease. The educational attainment gap between the rich and the poor has grown even further, with many of our children falling further behind. And though we've clapped our carers every week, they are still amongst the lowest paid in our society. The pandemic has laid bare the consequences of abandoning targets for ending poverty.
After 20 years of a Labour-led government, there are still 200,000 children living in poverty in Wales. A third of our children living in poverty is a blight on our communities, and something I am determined to change, with a £35 a week child payment targeted at families who have to decide between heating the home and feeding the children. Our childcare offer would boost the incomes of thousands of households, allowing non-working parents back into the workplace and create up to 3,000 new jobs. And a brand new national care service would make Wales the caring nation, valuing our care staff with salaries comparable with the NHS and making social care free at the point of delivery. I want to lead a government for all generations, a government delivering radical change, not for change's sake, but for the sake of the thousands of families whose futures rest on it. I want my son to grow up in a country where poverty is a distant memory, thanks to a belief that there is no challenge too big to overcome.
It can change, if we want it to change, but the change must start with us. In the shadow of this pandemic, ask not what you can do for your country. Ask not what Wales can do for you. Ask what we can do together for each other.
Angylion wrth fy ngwely. Ar awr enbyd bywyd, bu angylion wrth fy ngwely. Yn fy mae fy angel yn estyn llaw fach dawel a dweud â gwên, un diwrnod, gwn y dawr wawr dros y gorwel. Eto henon tywyni'n llaw nawdd I fy llonyddi, yn y tŷ neu'r ysbyty, bydd fy angel wrth fy ngwely. Angel dawel ydy hon, yn wylaidd mewn treialon. Mae hi'n wen dwy mewn enid du, mae hael hyd ei hymylon. Yn fy mae fy angel, yn estyn llaw fach dawel, a dweud â gwen, un diwrnod, gwn y dawr wawr dros y gorwel.
Helo a chroeso un panel trafod gellir gwell Cymru ar ôl Covid. Enw fi yw Delyth Jewel ac rwy'n weinidog cysgodol y blaid dros y dyfodol. I'm thrilled today to be joined by three remarkable panelists who will be sharing their insights about how society is changing, what needs to change, what they're worried has not changed, and what we can all do and what we need to focus on in the coming months to make sure that we actually do build something better after what's been happening the past few months with COVID and much else. So I said that I'm joined by three remarkable panelists, and I'll introduce them. So Professor Laura McAllister is a Professor of Public Policy and the Governance of Wales at the Wales Governance Centre, and she focuses on Welsh politics, devolution, electoral reform and gender, and she also has an illustrious career that I'm sure many other people will know in the sporting world and in journalism. Abu Bakr Madden Al-Shabazz is a subject expert on a number of areas, including the teaching of Black and African history. He's run his own programme on this at Cardiff University Centre for Lifelong Learning. He's taught and lectured at a number of universities, including Cardiff, and he has a specialism particularly on ancient African civilizations, but also multiculturalism, and he's been doing this for over 26 years, and we're delighted to have him with us. And Robin McAlpine is the director of the Commonweal think tank in Scotland. He started his career as a journalist and he was the first director of the Jimmy Reid Foundation. And over the past 20 years, he's worked in political media relations, parliamentary relations, publishing, and policy development. I'm delighted to have you all with us, join us for the conversation today, and I'll invite each of you to give a few opening remarks on this fascinating, important topic. So if I can ask Laura, please, to speak.
Diolch yn fawr iawn, Delyth, a diolch yn fawr iawn am y gwahoddiad hefyd. Thank you very much indeed for inviting me to be part of the panel. This is an enormous topic, isn't it? And it's the one that's on everyone's minds, understandably. And there's probably two ways of approaching it. One, to dwell on what has been a pretty horrendous 2020 for everyone and think about lots of the negatives, and there are more to come, no doubt. But there is another way of approaching it, and I'm minded to quote Gramsci here. I think I'm in the right company for that. You know, we're paraphrasing. You know, I'm an intellect. I'm an optimist because of the intellect. Sorry, start again. I'm a gosh, you know, get it right if you're going to quote Gramsci, isn't it, really? I'm a pessimist because of intelligence, but an optimist because of the will. And I think that's quite a good place to start, really, with this conversation, because I think we have to have some optimism. We have to have some will to change things, because I think COVID and the crisis of the past 7 months has really taught us that what we need to do as we push to a different future is make this based on the people. I think for too long, the whole debate about policy and politics generally has been a very elitist one. It's been driven by political elites and power elites. And I think if this pandemic has taught us everything, it's that the real power about changing things rests with the people. And that's why, you know, the Gramscian optimism is relevant. I think we've got to try and drive a new public and social contract with the people of Wales. It's got to be different. It's got to be based on radical change. It's got to be based on real structural change, I think, not just to the economy, but although that's absolutely fundamental, as part of kind of shedding the nonsense of austerity, which was, austerity was just another way of saying we're going to punish the poorest and most structurally disadvantaged people, yet we'll bail out banks and people with wealth and so on. So I think we've got to have a contract in a very different way. We've got to have some kind of belief that people's voices will be listened to. We've got to change the instruments of governance to make them far more democratic and representative. And diverse. If Black Lives Matter's taught us anything, and kind of structural gender equality for decades and decades, is that we have to make institutions and power more diverse. I mean, for me personally, I'd like to start not from government, but from a kind of different framework of how we relate to the public at large and how the public relates to all of us who do wield some influence at the moment and whose voices are heard, whether we're politicians or people in the public domain. And I'd like to think we could use some of the structures that we already have in place in Wales, not least the Cynhadledd and local governance, but also things like the Wellbeing and Future Generations legislation, which again, I think has so much potential, but has become kind of very if you like, and very elite. And I don't think out there people really realize what a potentially powerful instrument that could be in changing our future. So I think we've got a lot of the tools for change, but we need to be more ambitious, far less conservative in our thinking, far less wedded to old economic models, and probably put something really fundamental that would relate to the majority of Welsh people right at the heart of our new vision. But for me, I think that's got to be around education and social care, which I think are the two areas that probably touch all of us in Welsh life. And I'd like to see something really radical as the kind of fulcrum of change around social care and around how we change our next generation of young people through giving them a proper, significantly all-encompassing and radical education.
Fantastic. Thank you so much, Laura. Okay, there's lots that I know that we're all going to want to speak about. So Abu Bakr, if I could ask you for your remarks as well, please.
Thank you. Good afternoon, everybody, and thanks for inviting me to this forum. What I would like to say as my opening remark that what is taking place with the COVID-19 issue is that it's being compared to the Great Depression and World War II. And what has taken place as a result of this is that it's actually helped, not to a large extent, people, but it's actually caused the fall of society to a large extent where human activities are concerned. So let me just give you a few examples of what has taken place in education. Predicted grades for last term has left many students and families unimpressed with the results, which seem to show cultural, racial, class, and gender bias coming from either the teachers or the educational institutions. In economics, massive job losses and closures have impacted local and national economies, which have resulted in the closing down of major businesses and companies within major town centers around the country. The next thing, in entertainment, social distancing has impacted the social relationships and work of normal citizens to the point that recreational activities have attenuated to the point that anxiety levels and frustration have increased mental health instability amongst many people within society. And this doesn't forget how it's impacted and adversely people who already suffer with mental health issues. In the labor market, there has been a major reduction in hours of people, which have impacted wages, and now seeing employees asking the Department for Work and Pensions to top up their salaries through universal credits, which is now stretching the welfare state beyond its normal capacity, which has not really been seen since the miners' strike of the 1980s. And if we look at law and politics for an example, much reforms and policies have been brought forward by many politicians and legal specialists centered around COVID-19 pandemic, which is a global phenomenon. And the other thing as well is that it's left many politicians who are trying to help the situation vulnerable to their electees. And when we look at war as another example, for instance, we've actually seen an attenuation in war. So that in itself has probably caused the most positive aspect of the COVID-19, especially over the last 6, 7, 8 months. Okay, so we've seen a reduction in armaments being transported to other countries, etc. We've seen a reduction to some place with civil war or civil strife, etc., which actually shows that people are thinking more about themselves, countries are thinking more about their economies, and the thing is that people are trying to live in harmony, and the social distancing has actually put that apart in some way, which have actually caused war to be polarized or marginalized within people's life. These are the things which I want to say for my opening speech. Thank you very much.
Thank you so much, Abu Bakr. And then finally, last but by no means least, Robin McAlpine.
Okay, where to start? Fix COVID aftermath in 2 minutes. There's so much to say about this. We're a think tank. The second this kicked off, we just spent the last 7 months looking at everything that we could see that's happening, that will happen, and how to make this an opportunity, not a disaster. So there's so much I'm going to talk about that I could talk about, but I think I'm going to pick 2 things just now. And in both of these, what I want to emphasize is that it's probably best to think of COVID as an accelerant. It's accelerating things that were already happening. COVID itself, if it was other times, could come and go, assuming it does one day go, could come and go and everything underneath would be the same. But those are not those times. So there's 2 things in particular that I would like to highlight. The first is, and sorry for being very think tanky here, socioeconomic structure and place. So if you go through and look at history, we get these big moments of change, these big break moments. So you've got a point where feudalism breaks down and becomes mercantile capitalism. Then mercantile capitalism breaks down and becomes the kind of Victoria era of civic and globalized. It's globalized economics, localized civic space. That breaks down after the Second World War, and we redesign the world around the car. Hypermodernity. Everything has been designed around the car. It was already the case that the way that our society is structured, each of these, in my little town, you can see each of these. You can see the history of feudalism in the shape of the high street. You can see from that the mercantile capital era with the big high street in the local market town. You can see after that the civic centre, the town hall, the civic amenities and the open space that became aware. Then you can see after that when they put a trunk road right through the middle of what used to be a market town as the cars came. We were already moving past this. The internet was always going to change this. I did a project in late 90s, which was looking at home working. And I mean, my simple conclusion was this is bound to come. There's bound to be some decentralization of workplaces. And it's happening really, really rapidly now. So it's accelerated. I can't tell you how important this is. This is a massive, crucial social impact. Are we now all to be stuck in our boxes, our little houses, working from home and shopping from home, jumping into a car and traveling a distance for entertainment? And what does that do for community, society, and frankly, people's mental health? So are we going to rebuild the era of the car, the era of the town centre? Are we going to rebuild that as a sort of chicken coop dystopia, where we live and exist in little chicken coops and we purchase our way to feeling like we've got a life or a society by traveling somewhere else for entertainment? Because that's a disaster. Or are we going to relook at how we structure our immediate social surroundings? How do we create interaction, society, community, and a phrase that I really like, the social turbulence? That's a good thing. That's when 2 people bump into each other and slow each other down through the sheer power of being 2 humans talking to each other in the street, feeling empathy. That kind of social turbulence, if we lose that, we lose a large part of what we are. So how do we put that back in? The second thing is all about the neoliberal, the giant, big, long supply chains of the linear neoliberal economy. Now, again, we did a big piece of work last year, the world's first fully comprehensive and costed Green New Deal. And by the end of that, I had already concluded that it's not sustainable. It's not going to last as it is. We can't keep doing the dig, make, sell, bin model. We're running out of resources. But on top of that, this crazy, giant, big, long, stretched supply chains that are going around the world, don't let anyone tell you they're not vulnerable. They are vulnerable. It takes a small thing for every nation to start to hoard food. And as soon as that happens, you get a spiraling crisis. So for COVID, read, one region of the world has 3 years of catastrophic weather, can comfortably take 20% of the food supply out of the global economy, and then you get into this negative race. So we've got to look at this concept of an economy which always centralizes, always brings more and more in, everything gets bigger, because another outcome of what we're seeing just now is the economy as we understand it, the high street, the shops, everything that we've known is about to disappear if nothing happens, because it will consolidate in Amazon. We will have Amazon as a de facto economy for all of our consumption, and these other things will disappear. And then what happens if Amazon ever says, you know what, I don't like the politics of Scotland, of Wales, we're just going to withdraw our service. I mean, it's that fundamental and it's that scary. So we have to think about what the hell does economics post-vulnerability? So we called it resilience economics. What is economics, the economy, society look like in a resilient future? And in all of that, I didn't even get to say democracy. Yes, please, for the love of God. We live in one of the most centralized countries in the whole world, and you saw it during COVID. We are currently locking down regions the size of Belgium because there's an outbreak in one town. In Scotland, this is true. An outbreak in one town, we lock down the Highlands. That's the entire reason. That's because we don't have a smaller administrative unit. We need participatory and localized democracy. And all of this gives me the final hope, the real hope for Scotland, and I'm sure for Wales as well, that please let this be the last moment in our history when we look at dire statistics and how we performed during COVID and say, well, at least we're a bit better than England. I no longer want to be measured by how much better we are than the worst. Let this be the moment when we say, no, let's be two nations who measure our performance based on the best in the world, not the localist dumbest. Thanks.
Okay, thank you all. You've all given us lots of things to talk about, and how are we going to do this in the time that's left? The last point that Robin was making there about how we, well, looking at Scotland and also Wales, how we need to see this as a moment of opportunity, a transition moment. If I could ask you all, do you think, and I know, Robin, that you'll be seeing this as more of an outsider, but still, do you think that Wales has any natural advantage, either as a small nation or for any other reasons demographically, when it comes to being able to deliver meaningful and progressive change? Abu Bakr, if I could ask you first.
What I would say to that is basically, I think Wales could be a driving force for change if they have a good relationship, say, for instance, with their votees, with constituents, with their citizens, and trying to find out more of what sort of things are impacting their lives. And from that, actually trying to address that as soon as possible before it increases or proliferates in society, you know, try to address it as soon as possible. And I think that's one of the things that the advantage we got. The other advantage we got as well, that many of our politicians that work for the Welsh Assembly live in a lot of these communities, and they speak to the people as well, you know. They're not isolated really in a sense, you know, we can call at their doors or we can stop them in the street. They don't have that fear. So that's another, I think that's another thing. And I think basically if politicians are traveling on trains or public transportation, say, for instance, they can listen to the conversations which are taking place and trying to feed that back to the Senedd or to the centralized government in order to try to make those changes.
Absolutely, because people are closer, well, they are fewer of us, and we are the size of Wales. We're a relatively small nation. Because of that, it means that decisions can be made close to the people. In theory, that's how it should work. We need to make sure that actually does happen. Laura, what do you think?
Well, starting with your last point, I mean, the Senedd is far too small, as we know, and I'm not going to go on a rant here about why that needs to change, but it is part of the dialogue we need to have with citizens, because otherwise we allow it to become seen as an elite level issue. And the problem we have with the Senedd size is that it isn't able to serve the people of Wales effectively. It isn't able to scrutinise the government and all its agencies, and therefore it's failing the people of Wales. So I won't be told by anybody that this is an elite bubble issue. It's an issue that affects everybody's day-to-day lives. But that's an aside. I think Robin made a really good point about not positioning ourselves and not juxtapositioning ourselves, particularly with England, and I think in some regards, if I can be mildly critical here, I think Plaid has been too prone to that in the past, much as the SNP has actually in Scotland. And it's too easy, really, because if you step back from that, you can't have your cake and eat it on these issues. In my opinion, the current state of the apparatus of the British state is almost moribund. It's failing in so many ways that we shouldn't be comparing anything we do in Scotland and Wales with what's going on in the central power base of England and the UK. I think we need to look at other countries across the world, and I don't think size comes into it, actually. I mean, if you look at some countries which are either small, medium, or big, they've handled COVID in much better ways than we have in either Wales or in the UK. And I really don't think size is the issue here. For me, it's more a question of ambition and trust. I think whatever size you are as a nation, you can still be ambitious about your societal goals and your respect that you want to act as a value and as a foundation for your society. And equally, I think it's about trusting people to come along that journey with you. I get a sense that we are at a really critical turning point. I think people have seen some of the flaws of the model of governance that we have currently in the UK. And whilst kind of populist opinion will try and drag those people to the extremities, I think the vast majority of sensible people want a kind of a policy radical alternative to where we are currently. And as I said earlier, I think that's got to be based on two areas which for me hit most people, and that's education and the whole area of health and social care. And if we could just invest in a really radical alternative model to both of those policy areas, then I think we've put in place some of the foundations of a really different society. But just a word of warning here, I think we've all got to have a big dose of reality poured into this as well, because we can't keep calling for Scandinavian style public services and then be frightened to actually tax in the way that societies which do provide better public services do. Never has there been a better time to borrow, of course, in order to fund effective public service delivery. But I think, political parties and all of us as a public as well need to be a bit more realistic. We can't have our cake and eat it. We need to invest if we're going to deliver a better quality of public service and life generally to the people of Wales.
Thank you. Robin?
Right, okay, so this is really at the heart of what Commonweal does, which is we began by looking at smaller nations around the world to see what you could learn about what Scotland could do better and differently. And as soon as you start looking at it, there's a conclusion you'll find it's not really a discussion point, it's the case. Small countries, small entities can turn and change faster than big ones. I mean, it just is. Now, the flip of that is that they get buffeted by global forces, potentially, more than the big ones. So it's just a standard threat opportunity thing. But yes, you can turn faster. Yes, you can do things quicker. But yes, if you get it wrong, you can be screwed over worse. Now, that's going back to my introductory points here. That's the difficulty here. My guess would be, and I'll put it on the record now, my guess would be that what we're about to see will be an economic restructuring bigger and more sustained than what happened in the deindustrialisation of the 1990s. Now, we know how that went for Wales, we know how that went for Scotland. So the answer to this is yes, we can turn faster. And just very slightly to disagree with Laura, if you look at most of the places that did well with COVID, they're either smaller or decentralised. So somewhere like Germany is big, but they've got powerful lander, which took over the job of localising the response. Somewhere like Rwanda, it's big. Rwanda did really well because they used existing informal local networks. So it's the decentralization. If you can be bigger if you're decentralized. What you can't do is, whack a virus with a hammer from London. That's what doesn't work. That's why it all goes wrong. So I am absolutely adamant, really, really, really confident that both Scotland and Wales can turn quickly and face this new economy in ways that I think would be I think they would set the pace. I genuinely think that people around the world wouldn't be studying the Nordic model, they'd be studying the Anglo-Scots model, the Welsh-Scots model in future. And I think that's a real reality. And there's all sorts of things to say about this, because yes, you need higher taxes, but it's fundamentally about the structure of the economy. We did it, to pick up that tax point, we did a paper on this a while back. We did an analysis of the Nordic countries, and we said, right, look, imagine you didn't raise tax at all in Scotland. You kept tax precisely where it is at every band. And all you did was restructure the economy to have the wage distribution, the wealth distribution of a Nordic country. So nothing else apart from that. It generated between £4 and £6 billion, because suddenly people at the bottom end of the economic spectrum are able to pay taxes, and people at the top end of the economic spectrum are less easy able to avoid the tax bill. So there's all sorts of ways that you can turn these things around. But there's another way to think about this as well, which is, okay, you can turn what's stopping you. What's the thing that's stopping you? Now, this is also crucial for both Scotland and Wales. What's stopping us is the City of London. And I don't mean just the capital city, I mean the financial city of London. Because forever and a day, until it finally collapses, all UK macroeconomic policy, monetary policy, all the framework within which we live will be designed for the City of London to keep it safe. This has led to underdevelopment. So if you look at Scotland, why is our economy comparatively struggling in the UK context? It's because we've got all these natural resources. We've got all these human resources in Scotland, and they're underdeveloped. They're not used properly because they're not speculative assets. They are real assets. And so we don't make things, we don't do things in Britain. So Wales is exactly the same. Wales is an underdeveloped country. So now let me flip back from the negative to the positive. The drag is London. The thing that's stopping it is London. But take that away, and the thing that happens next is the ability to unlock what has been locked, what has been underdeveloped. So can we do this? Yes, sure as hell we can. If we were able to unlock the underdevelopment of both the Welsh and Scottish economies, and we were able to do that quickly, we could bounce back from COVID, and I hate all the language, but pivot round to the thing that we need to be next. And we could do all this while we were doing all the right things with public services and the economy at the same time. So it's absolutely possible. It's all about will and courage.
Okay, on that point then, Robin, do you think that, so in terms of what we've all been talking about, that there is this opportunity now, and as Laura was saying, that we all need to be realistic and confront the fact that there's some big fundamental changes that would need to take place if we want society to actually change in the way that we all want it to. Do you think that we have that will as a society, with our politics, with how society is structured? Do you think the resilience is there in order to take the shocks that it would entail? So Robin first, because it carries on from what you were just saying.
Well, this is another benefit that Scotland's got, and I'm doing benefit in the bunny rabbit years. We're terribly underpopulated as well. Scotland's been underpopulated for so long because of mass emigration and all sorts of other problems that we've had, that, I mean, we're honestly about sexiest kicking about this entire big nation up here. We've got so much space, we've got so much resources. Scotland is calorie self-sufficient. We produce as many calories in the food as we eat. We're not only energy self-sufficient, we've got so much of it, we don't know what to do with it. We literally, all of our energy needs and more will be met by onshore and offshore wind, and we've got all of our subsea energy. We've got resources coming out of our ears. So can we weather it? Can we get through it? Yeah, we can. This is something that you can do quickly. And will we be seeing change? Yes, we're going to be seeing change, categorically. Clear from your minds the thoughts that we're going back to where we were. I mean, the fact that people now say, oh, plus climate change is in itself telling, where everyone's going to change even without climate change. And that's, I mean, seriously, the stuff that's going on just now is really alarming. Is it getting better? Well, let's just go up for a tick here and first of all point out that, as every lefty for all of history points out, if you do public attitudes, the public's much closer to a left position than a right position on the economy and public services. sometimes not war, and identity issues, but in public services and on the economy, they're always way to the left of where central governments are, which takes us back to the City of London again. There's evidence that's being done just now, and I can't cite you, I've got it cut out here. It was a piece in the Financial Times about European attitudes post-COVID. They've all moved to the left, quite sharply to the left. In fact, I just read, that's, does anyone see what the minimum wage is in Switzerland now? They've just upped the minimum wage. You must now be paid £40,000 a year minimum. That's the minimum wage. Now that was rejected in 2 referendums. So it's £19 an hour. It's an incredibly expensive country to live in. But 2 referendums twice rejected a sharp rise in the minimum wage. And another one just happened this week and it passed. Now that's telling, that's a change. Things are shifting. What is really galling for me is that this moment could flip us by in the blink of a Cummings if it's left to London. So that's what happened. There was a moment of change in 2009 after the financial crisis, and we got bloody Cameron, who took all the change, distorted it into austerity, and ruined the opportunity. What we've got just now is effectively disaster capitalism as a Westminster-sponsored model. Dominic Cummings wants to use this to rip apart everything from the BBC to old monopolies and mergers. Everything will change. We can do something different, but we need the power and we need the courage. And how are we going to have the power and the courage? Well, that's a different question, which we may pick up on.
Abu Bakr, in your opening remarks, you were talking about the kind of the shocks that have been felt to young people through the education system and everything that they've had to go through in the past few months through, with what's happening with climate change, all these really big changes that are shocking our society. Do you think that our society is resilient enough to change? Do you feel hopeful about that?
I think the society can change. I think we've learned lessons from the last term. And what I mean by the last term, I mean the predicted grades which many of the students received. Many of the students weren't happy. Many of them were going through their transitional phase, from school to college. Many of them were going from college to work, and the grades didn't really seem to sustain them as individuals as far as, entering a new profession. So I think we've learned something from that. So if we do go under, constant lockdown right through until 2020, when we don't really know, we'll have to see what happens, then we can learn from the mistakes of the past, where the predicted grades, if it does end up being like that, it needs to be more fair. We need to look more at who is actually grading, what different institutions and bodies can do to ensure that the grading is more fair, what teachers may need to look at, because some students are okay on examinations, but not with coursework and vice versa. And this is where a lot of the problems were. But I think we need to give confidence to the younger generation because they do feel they've been let down. There's a lack of role models within their communities, within their families, or their locality, even the society. We need to look at what type of things that we can do to try to increase their abilities and their motivation so they can meet 2020, 2021 with more of a positive notion as far as their personal and professional development is concerned, because they are the adults for the future and we want them to learn from our mistakes. So if we rectify things, like say with their grades or trying to improve their condition now, for the future, then they will become better, leaders and responsible individuals that if they do make mistakes and there's an element of accountability, they're able to acknowledge their mistakes and they're able to rectify their behavior on a more positive note.
Thank you. And Laura, responding to what Abu Bakr and Robin have just said, I mean, in terms of whether our economy and our society in so many different ways have the resilience built in, do you think that is the case? And especially with Abu Bakr, what he was just saying, do you think that the generation and the generations to come have a reason to feel hopeful about all of this or not?
Well, I thought Abu Bakr's point was a really good one. There's an old Greek proverb which says the best time to plant a tree was 20 years ago, and the second best time is now. And I think, it's a bit, it's a silly expression in some regards, but it's an important one in others, because if we talk about the relationship between young people and politicians stroke the state, we know that they're much more challenging, they're much less likely to be compliant, but that means that they're also more ambitious and aspirational. And I think that's the energy we have to channel now. Young people, nothing frightens young people in terms of potential political futures. And what frightens them is more of the same, so that we destroy our environment. We have an economy that only benefits a tiny proportion of people, where we have, thousands of children and young people stuck in poverty. That frightens them. But things like, radical constitutional change and independence in the case of Plaid's ambition doesn't frighten young people. Rejoining the EU doesn't frighten them. And this is the kind of energy we need to capture, really. We need to let young people have their voices, give them the platforms that allow them to do that. And that's why I think, by the way, votes at 16 that will of course come in the Senedd elections next year is important. It's not a panacea, by the way, but it does at least allow us to encourage young people to feel they are political beings and that they are citizens from as young an age as we possibly can. But then I think there's a bit of a dilemma here. I'm sorry to move from something really positive to something really negative, but we're 7 months away from a Senedd election. Clearly Plaid Cymru will be hoping to do as well as it possibly can in that election to be powerful in the shaping of a new government, let's say. The danger for you as a party, I suspect, is that you've got to harness that big ambition and those huge aspirations and the big macro piece about a very different Wales with some degree of realism that will encourage people who haven't voted Plaid Cymru before to vote Plaid Cymru next May. So I think that's a difficult but not impossible bridging job for you. And without wishing to get into kind of election strategies and so on, I do think we've got to keep those two balls in the air at the same time. Every party does, not just Plaid. There's got to be an eye on a really big future with a different value set, with a foundational economy, possibly with a shorter working week. Some of the things Robin talked about a moment ago. But equally, I think all of the political parties have got to give some real credible alternative policies to the electorate that makes them want to go out and vote in the May elections. So I think you've got a tough task ahead as political parties, but it's not an insurmountable one as well. Keep the big macro utopian vision there, but drill down into some policies like social care, potential new levy, the Jerry Holtham idea of a levy on health and social care, or even an educational levy, as my colleague Calvin Jones in Cardiff University's put forward, where we can really invest in teachers so that the profile and the status of education is enhanced as it is in some other countries. So it's got to be some really hard, credible policies, but with some big, big ideas alongside them, I think.
Thank you for that, Lorna. I'm afraid that we're very fast running out of time here, but before I ask you just for your closing thoughts, if I could just ask Robin and Abu Bakr if there was anything they wanted to add to that, because that was one of the questions I was going to ask actually, in terms of whether there are specific policies that you think that progressive parties should be pushing for upcoming elections in order to make sure that the changes we want to see in society could actually come about. So Robin, if I ask you first and then I'll come to Abu Bakr. And forgive me because we're quite short on time, I'm afraid. Relatively.
I know. I can tell. There's no way to cover this. There's just so much of it. Let me give you a strategy for thinking about it. Just picking up what Laura said. For people that don't know, I'm primarily a political strategist. I got into think tanks because the left's really bad at doing think tanks. So, as a political strategist, if you look at what I would advise is think about a time machine. Right, so think of your policy agenda as a time machine. What is the world you want to reach? How do you bring elements of it right here now in a time machine? So what policies impact on people's lives now? They can feel them now, happening now, as real things that make a difference, but are little time capsules from the place you want to get them to. And if I say that at the heart of ours, for example, is an incubator for a proper Green New Deal. This is hundreds of thousands of jobs. We're going to have to do this. There's no question we're going to have to do this. Do it now. Do it right now. Bring it right forward. Do an ambitious incubator, 4-year incubator for a Green New Deal now. It creates jobs in industry, a lot of supply chains. It creates new training opportunity. It takes a vision of where you're going to. You can do most of the incubation part of it just now. Westminster becomes a problem after that. But we figured that the vast majority of what needs to get done in the first 4 years, you can do with the powers of devolution. So I would say you can talk to anybody about that. You can talk to rural communities or cities. You can talk to the young. You can talk to the old. You can talk to small and medium-sized businesses. Big business isn't so keen. You can talk to everybody. But just as importantly, it says, look where we're going. This is the world we lead to. So time machine your way back with policies that let people feel the place you want them to go and do it now.
I like that, time machine as a verb. That's nice. Abu Bakr, what policies do you think that progressive parties should be focusing on at the moment?
I think the progressive parties to focus on 4 strands, which is looking at the individual, looking at the individual, the family, the locality, and the society. In relation in saying that, what policies I think they should bring forth to the electorate is looking at the care industry. Yeah, for the practitioners as well as the vulnerable people, especially pre-post COVID-19. This is really important. I think it's really shook up the healthcare industries, literally, for practitioners as well as vulnerable people, how maybe lackadaisy we have been as far as the care industry is concerned, especially with safeguarding issues, and maybe safeguarding issues were basically targeted more towards maybe the vulnerable as opposed to the practitioners, or maybe vice versa, because of a lack of resources, due to a lack of funding and these type of things. So that's one thing which needs to really be emphasized by the progressive parties. The next thing is looking at the youth culture, looking at young people. Yeah, they have literally lost confidence in 2020. And as we would say, 2020 vision should be a clear vision for people. And many young people are not seeing that, especially those who are transcending from, primary school into secondary school, and then the next transition from secondary school into colleges or into work, and from colleges into work. Yeah, we need to build a lot of confidence with them, and the political parties really need to speak to the young people. And the last one is looking at the economy and how we can sustain ourselves during the lockdown or during the curfews, making sure there's plenty of food within our stores and our shops, because it hasn't really impacted our food commodities. And that's one good thing under that strategy. And the other thing as well is looking at the economy as far as earning power and spending power for people are, because many people have been put out of work, unfortunately. Businesses and companies have closed down, and how we can try to bring, sustainability where the average man or woman with a family can sustain themselves and still, acquire and live how they were living before the coronavirus had taken step into our lives.
Thank you so much. Now, I'm afraid we've run over time, so if I could just ask you all, because you've all been so fascinating, to briefly set out just any closing remarks, particularly answering whether or not you feel hopeful about the Wales that will come after COVID. And if I ask you, Abu Bakr, to go first, please.
I am hopeful to an extent, but that might be selfish for me because I work in education, etc. The COVID, as far as the Labour is concerned, they really haven't impacted me, and I've been able to work from home. So, speaking for me as an individual and for people in my profession, something positive has actually come out of that. We can still teach online, and we have technology at our fingertips, where we can still carry out our daily work. So from that perspective, there's a lot of positivity, and I feel very hopeful where the educational industry is concerned. I may not be able to speak so much on other industries, but as far as the educational industry is concerned, definitely.
Thank you so much. Laura, do you feel hopeful?
Well, yeah, I mean, I'm a glass half full person. So whilst I recognise that there are massive challenges ahead, I think there are the seeds of something different as well. And it's up to all of us to capitalise on those opportunities, really. I mean, if COVID has taught us anything, it is that, we are a society and we are communities. And, despite the fact that the disease has hit groups in different ways, and that huge structural inequalities in our society have been exposed, we've all been in the same or similar situations together, even if the impact has been different on each of us. So I think, turning that on its head, it does give us an opportunity to talk more about relationships between people and communities, and between regions and between nations. So that's a sense of optimism. But I think we've got to harness it. And the pessimism for me is that it's very easy to slip back into old ways of thinking and to undo some of the behavioural change that we've seen, you know, around green transport and so on, and the power of the car that Robin alluded to earlier on. And I think we've got those of us who feel passionately about this, and I think we're in a majority, by the way, have got to really stand up and speak out, because if we don't, you know, it's very easy to get sucked back into old ways of working and old ways of behaving. And I think this is a moment for us, as we've all said during the session, it's a moment for us to kind of demand more, but put ourselves as part of the solution as well, and take on some responsibility for doing some of this ourselves. The longer we just see a political class that does things for us, a kind of transactional model of politics, the longer we'll see the kind of inequalities that we're seeing now. You know, this has got to be about all of us with a similar voice, even if it's not quite the same volume, but all of us being able to speak out with a real desire for change, I think.
Diolch yn fawr iawn. Thank you so much. And Robin, finally, do you feel hopeful?
Well, I'm from the left, so I mean, it's a contractual obligation that I'm pessimistic about the present and optimistic about the future, or we'd all be swinging from trees outside. But I mean, genuinely am. I mean, the thing which I was pessimistic about before was we were stuck in this big, awful, ugly system, and I didn't know what was going to break it. I mean, was climate change going to break it? This system has defended itself, built itself so strong that to get to the next thing, we had to break it, and it's breaking. So I know that what we can do next can be better. I know, I'm certain, I'm not in doubt that what we can do next can be better. So in that sense, I am optimistic. And the key for Wales, though, and it's a Plaid conference, is there's no point in saying 4 years' time, it would have been good if we'd won that election because we really could have started the transformation of Wales, because I don't really think Labour's going to do that by itself. So I was down at the conference last year, and it didn't feel, it was really, I had a wonderful time, as you know. It was really great, but it didn't quite feel like a party that was ready to grasp power. Now, it's unfortunate you can't be together now, but wherever the hell you are watching this at home, you've got to give yourself a shake. Take power in May or regret it. Take power in May or regret it. You need to make the change happen. And it's not going to happen if you don't win. So get your heads around the fact that it's all sitting on you. Am I more optimistic? I saw more humanity in 2020 than I saw in 2019. And if it's nothing else, then yes, humanity has been everywhere this year. So I am optimistic. And if it doesn't work out, I'm just going to have to find a Swiss company that will let me work from home. That will clearly be the solution.
Diolch yn fawr iawn. Well, thank you all so much. Diolch cymaint i'ch gyd am gymryd rhan yn y drafodaeth hollol fascinating yna. Fi'n gobeithio'n fawr bydd y bobl cartre yn mwynhau fe cymaint ag o'n i. Diolch yn fawr iawn i chi gyd.